Good morning, good afternoon, perhaps, wherever you are. Welcome to the second annual NIHHIS National Meeting. Thank you very much for joining here. My name is Julie Turton. I am with the National Oceanic and Atmospheric Administration and in the Climate Program Office, and I am one of the co-leads of NIHHIS along with my colleague Paul Schramm from the Centers for Disease Control and Kim McMahon from the Weather Service. I'm going to introduce you to the meeting and to what's ahead of you. But first, before we get started, I have a few administrative notes to add here. Meeting is being recorded. We will ask that you keep your mics on mute and cameras off unless you are presenting or on a panel when you're asked to turn your videos on. Additionally, live transcription is available at the bottom of your Zoom screen. And please feel free to use the chat for sharing resources, etc., but try to keep it on point. We will have the chat function on except during the keynote speakers and the federal panel at the end of the day. We'll also be enabling the Q&A during sessions. So we are doing our best to make this as interactive and as engaging as one can in a virtual sense. I think we've all learned how to do that well in the last few years with the pandemic. So we're really happy to have you all here today. We're happy to be here ourselves. NIHHIS was designed back in 2015 and launched to really help the country better prepare and coordinate its activities to manage the health risks of heat across multiple timescales. So initially, we were created under the National Security Council Infrastructure Working Group to address the health risks of heat across infrastructure. And we have evolved to really begin to address heat, both improving the forecasts and warnings and helping the Weather Service with information to do that across their seasonal and weather timescales, and all the way to building resilience, heat resilience in communities and sectors across the United States. We also do have a very active engagement with our international partners so we can more effectively learn from each other and share knowledge and move further, faster together against this really not so emerging challenge, the challenge that's already here. So the meeting today is designed to do a couple of things. And one of the goals of NIHHIS is to really learn from each other and create the space for folks to learn from each other as well. So this is a federal government initiative with a very large interest and capacity to engage with state, local, tribal, and territorial partners, as well as the non-federal universe of private sector and NGO. So throughout the meeting today, you're going to hear from a lot of different partners. I want to thank, however, the NIHHIS Interagency Steering Committee and the Communications Group. NIHHIS is comprised of several agencies, including the Environmental Protection Agency, NOAA, obviously, several different parts of Health and Human Services, including the CDC, the National Institutes for Occupational Health and Safety, NIOSH, the new Office of Climate Change and Health Equity, the Substance and Mental Health Services Administration, Assistant Secretary for Preparedness and Response, NIH, and others within HHS, so very active engagement from Health and Human Services. We have the Veterans Administration, we have the Forest Service, Department of Labor, Occupational Safety and Health Administration, Federal Emergency Management Administration, FEMA, and then we have the Housing and Urban Development as one of our newest partners, and emerging also with the Department of Transportation. So you're going to hear throughout the day and the next few days from those agencies. You're going to hear from state and local partners. You're going to hear from topical experts and others who actually will be asking questions. So we have a few interactive sessions as well and some panels. I think with this point, I will actually ask Paul Schramm to turn on his camera. And Paul, my co-chair here, please take it away for the rest of the intros.
Right. Thank you, Julie. Hi, everyone. I'm Paul Schramm. I'm the climate science team lead at the Centers for Disease Control and Prevention. And as Julie mentioned, along with her and Kim, I'm one of the co-chairs of NIHHIS. So on behalf of CDC and NIHHIS, I want to welcome you all and thank you all for attending. And also thank you all for the work that you do to help communities across the country prepare for and respond to extreme heat. Over the next 3 days of this meeting, we'll be focusing on 3 topic areas. The first is intersections in heat and health. The second is highlighting science, innovation, and research. And third, state, local, territorial, and tribal policies and practices in heat planning. So you can find information on all of the sessions that we'll be having over the next 3 days on the website. So we're excited to welcome a number of speakers and leaders on these topics and look forward to the discussion and interactive sessions. And of course, there are many other critical heat-related topics, such as international impacts of heat, that NIHHIS covers and will continue to expand on in future meetings. I'd also like to extend a huge thank you to the communication team here at CDC, who handled the technical logistics of this meeting and the platform and the chat and all of that. And speaking of that, I'll now turn it over to my colleague, Jonathan Lynch, to discuss CDC's Environmental Health Nexus. Jonathan?
Thank you. Thank you, everyone, so much. I'm Jonathan Lynch. I'm the Deputy Associate Director for Communication for CDC's Division of Environmental Health Science and Practice, and part of the NIHHIS team. Next slide, please. So, quick note about NIHHIS. The team manages a suite of communication channels used to share environmental health messages with the public, with public health agencies, environmental health academia, and several other groups. We coordinate the use of multiple channels for synergistic benefits. So our efforts kind of get multiplied along these different channels. And we serve as a hub for connecting many different types of partners. We host events that pull in people from all these different sectors to help enhance our communication efforts for environmental health. Next slide, please. Okay, here are the channels we manage. We, of course, manage our NIHHIS webinars, our monthly newsletter. I'm going to encourage everyone here to sign up for the newsletter. Multiple partner communication channels. We do some work in social media, of course, and we manage conferences. Next slide, please. Okay, and if you want to connect with us, you can see, and we're about to post these links in the chat, but you can see the links here to our website, for subscribing to the newsletter, for attending the webinars. And if you are part of an environmental health organization or an organization that has a stakeholder role in environmental health, then please email us at ehNexus@cdc.gov so we can connect and get you connected with the Nexus. Next slide, please. Okay, thank you.
All right, thank you, Jonathan. And that's great. NIHHIS really highlights, the links between the environment and our health, including heat, which we're focusing on today. So now we're going to hear from our first keynote opening speaker, CDC Director, Dr. Rochelle Walensky. The CDC is thrilled to be collaborating with NOAA as co-leads for NIHHIS as the leading health agency. The human health impacts of climate change, including extreme heat events, is a priority for CDC, and we're honored to have the support of our director on this topic. Now I'll turn it over to Dr. Walensky.
Good morning. When we gathered in April last year, we did not know 2022 would bring the 6th hottest summer on record, as reported by our colleagues at the National Oceanic and Atmospheric Association. As we gather this year, we recognize climate change continues to be one of the most urgent public health challenges of our time. We gather because we know that heat waves are continuing to intensify, to last longer, to span larger areas, and are putting the lives and well-being of many at risk. We gather because we are hopeful the partnerships represented by this national meeting can make a difference. We have more tools, more data, more information than ever before, and most importantly, we have all of you. You are familiar with one of the tools I reference, CDC's Heat and Health Tracker. Its open access, real-time, local-level heat and health data is helping health departments, emergency managers, and communities better prepare for and respond to extreme heat events. The tracker displays a month in advance the expected number of days at or above a dangerous level of public health, and provides near real-time information on heat-related emergency department visits, leveraging data by CDC's National Syndromic Surveillance Program. Another tool is our National Environmental Public Health Tracking Network, which shares 36 heat exposure and vulnerability indicators that are continuously updated with recent data. For example, by providing data for days when it is extremely hot in each census tract across the country, the network can help public health professionals plan to mitigate the effect on elderly people living alone or families facing difficulty paying their energy bills and maintaining safe temperatures in their home. This year, the National Weather Service will launch their heat risk tool, incorporating high-resolution climatology and locally relevant health evidence in an easy-to-use format that applies a consistent approach across different climate regions. CDC and the National Weather Service worked together to identify temperature thresholds and develop an alert system that issues heat forecasts using data and methods relevant from a public health perspective. NOAA's environmental data, drought and heat data from the National Weather Service all complement CDC's health data and also underpin CDC's ability to provide financial support to health departments and local jurisdictions, support which can then be used to respond to the impacts of heat, wildfires, and flooding. Combine these data sets with the assets of our partners at the Department of Veterans Affairs, the Environmental Protection Agency, the Occupational Safety and Health Administration, and the Federal Emergency Management Agency, and we have the tools to deal with the very real threats posed by extreme heat. Certainly, CDC's National Institute for Occupational Safety and Health, NIHHIS, has a long history of researching heat stress in occupational settings. In 2016, NIHHIS published an update to the criteria for a recommended standard on occupational heat exposure, which provides recommendations for addressing hot work environments and protecting workers. In the absence of a federal workplace standard on heat, this has been a very important resource. And we continue to conduct research on the effects of heat stress on workers, heat that comes not only from the environment, but the additional heat that comes from wearing personal protective equipment and protective clothing while working at tasks that require a lot of physical exertion. A training module published by NIHHIS in April helps workers recognize the signs of heat-related illness and provide appropriate first aid. Though the training, called Keeping Cool, was developed by the NIHHIS mining program, it's applicable for anyone who works in a hot environment, including those who work outdoors in hot climates and workers in hot plants, mills, or similar facilities. Topics include how to self-regulate behaviors while off shift to enhance the body's ability to handle heat stress, as well as how to assess the risk of heat stress on the job, maintaining hydration, taking rest breaks, and taking first aid actions when feeling symptoms of heat-related illness are among other protective actions covered. The training is part of our work to be sure occupational heat stress safety is addressed across a wide variety of worker populations, including through collaborations with outside organizations such as the American Industrial Hygiene Association and their efforts to improve occupational heat stress awareness and education among safety and health professionals, employers, workers, and small businesses. At CDC, we have one of the few government-focused climate and health programs supporting health departments across the country to build resilience against climate impacts. Since 2010, the Climate Ready States and Cities Initiative has provided a range of technical assistance to state, tribal, local, and territorial health departments to prepare for and respond to the heat effects of a changing climate. The recipients have used the Building Resilience Against Climate Effects framework to identify likely climate impacts in their communities, potential health effects associated with these impacts, and their most at-risk populations and locations. Since the launch of the current grant cycle in 2021, over 33 million people have benefited from these initiatives, and a total of over 57 million people are projected to benefit over the course of the 5-year grant. One example of the initiative's impact can be found in Arizona. The Arizona Department of Health Services used CDC Heat and Health Tracker as the model for their county-level dashboard, identifying locations for cooling centers to best meet demand and support their communities. And supported by the Climate Ready States and Cities Initiative, the California Department of Public Health is leading or supporting 21 recommended actions in the state's cross-agency California Extreme Heat Action Plan, developed to help prevent and reduce cases of heat-related illness among at-risk workers, and expected to lead to the adoption of an indoor heat illness prevention standard. As you recognize from these examples, we recognize that as with all health crises, everyone is not equally affected. The impacts of extreme heat disproportionately affect those with greater risk for exposure and those who have fewer resources, including those who do not have access to air conditioning, older adults, particularly those in rural areas, young children, socially isolated populations, people with chronic conditions, and some communities of color. The impacts can disproportionately affect work populations, including those working outdoors, migrant and immigrant workers, and those working for small businesses. A CDC study published in 2020 found that from 2004 through 2008, American Indian and Alaska Native people had the highest rate of heat-related deaths among all race and ethnic groups, followed by non-Hispanic Black individuals. Older adults can also be vulnerable to the health impacts of power disruption associated with many hazardous events, including heat waves. A study of emergency department visits led by CDC's National Center for Environmental Health found that people over the age of 75 were the most affected group during the Pacific Northwest heat wave of 2021. In addition, older adults residing in rural areas are less likely to benefit from community resources for heat impact mitigation and adaptation that are most often available in urban areas. In 2022, CDC developed a national climate and health strategic framework in response to the administration's executive order on tackling the climate crises at home and abroad. The framework helps address health inequities and environmental injustices worsened or affected by climate change, improve our ability to track climate-sensitive diseases such as asthma, heart disease, and those spread by ticks and mosquitoes, collect more data on how climate change is affecting people's health, and share information to protect communities from climate-sensitive diseases. As we recently launched our Environmental Justice Index, the first national place-based tool designed to measure the cumulative impacts of environmental burden through the lens of human health and health equity. All people, regardless of race, color, national origin, or income, are entitled to equal protection from environmental and health hazards and equal access to the development, implementation, and enforcement of environmental laws, regulations, and policies. As I said earlier, we are gathered because we are hopeful the partnerships represented in this national meeting can make a difference. We have more tools, more data, more information than ever before, and we have all of you. Together, we will share our knowledge and harness our data to better predict health outcomes, and we look forward to seeing how you will put this to work in your community. Thank you for being on this journey with us. And now I'm happy to turn the podium over to Dr. Richard Spinrad, the administrator of the National Oceanic and Atmospheric Administration, and one of our critical partners as we work to grow our knowledge and harness our data in the service of public health.
Thank you, Dr. Walensky, for those amazing remarks and for your long-standing partnership from CDC, between CDC and NOAA. Dr. Spinrad, thank you so much for being here. It is my great honor to introduce the head of NOAA, the Undersecretary for Oceans and Atmosphere for Department of Commerce, and the administrator of NOAA. Dr. Spinrad comes to this from a couple of avenues here. He has had several roles at NOAA, including that of chief scientist and the head of the research part of NOAA and the head of the ocean service part of NOAA. He also has a background at the Office of Naval Research, so he knows from where he speaks. But interestingly and fabulously for us, he was also a part of the initial phase of scoping and launching the National Integrated Heat Health Information System. So we are so pleased, Dr. Spinrad, to have you back with us again this year. Thank you very much for being here. Very grateful for your support and your attention to this really important matter for the country.
Yeah, thank you, Julie. It really is an honor and a treat for me to join all of our honored guests and friends and colleagues today. And I look forward to spending just a few minutes to help open this second annual NIHHIS national meeting alongside, obviously, our colleagues from CDC and the health sector. This is an issue of personal interest to me. It's one that I think is so relevant to what's happening in the world right now. And I want to spend just a few minutes talking about the value proposition, if you will, and some of the successes we've had and what I look forward to in the future. NIHHIS was formed because the science indicated that in our country, we were going to continue to experience more intense heat waves, changes in the nature and magnitude and duration of the heat season, and overall increases in heat. We also knew that while agencies were working on aspects of heat, no individual agency would lead us to an adequate level of heat preparedness for our communities or our economy for that matter. And as you'll see today from the breadth of agencies that are involved throughout this meeting, that remains true to this day. I think it's imperative that we're addressing heat at every scale and at every level of governance, which is why I'm so pleased to see the deepening engagement with our state and local partners, non-governmental organizations, and also our emerging private sector stakeholders. By broadening and localizing our response to heat, we're going to be building an important part of addressing the stark inequities that we see when temperatures soar. Heat adversely affects those who are least equipped to protect themselves from a heat event. And that's why NIHHIS is one of this administration's Justice 40 initiative priorities. To help our country more effectively and rapidly address these environmental justice and equity concerns related to heat. One of the greatest challenges that we have in addressing extreme heat is that its impacts are often quietly borne by individuals and communities that are often overlooked. The work of NIHHIS is urgent as we continue to watch heat records be broken. In the summer of 2022, that was our third hottest on record in the United States. And in addition, in 2022, the contiguous U.S. experienced its second warmest summer nighttime temperatures on record since 1895. Nature doesn't segregate risks, and so we see cascading risks between heat, drought, and wildfire impacts. And mixing these high temperatures with the threat of major power outages can lead to major disasters on the infrastructure, the economy, and of course on human, animal, and environmental health. Since I last spoke at the first NIHHIS national meeting last year, the National Integrated Heat Health Information System has made a lot of progress in helping us build what we call a climate-ready nation that is resilient to extreme heat. In July of 2022, we worked with the Biden administration to launch heat.gov, the premier federal website providing the public and decision makers with clear, timely, and science-based information to understand and reduce the health risks of extreme heat. We are aiming for a climate-ready, which also means a heat-ready nation by 2030. Additionally, NIHHIS and NOAA have worked with citizen scientists to map the urban heat islands of over 60 communities across the country and around the world. And I'm pleased to note that we will be mapping 18 new communities this summer. Over the past 7 years, we've seen a variety of different cooling solutions that communities have been able to implement in their own neighborhoods as an outcome of the mapping results. For example, we mapped Las Vegas last summer to help plan for future heat events through scenario exercises. Cincinnati, Ohio, mapped in 2020, has been implementing a tree planting initiative, and Jackson, Mississippi is developing a community-based heat emergency preparedness plan. NIHHIS worked with the Office of Climate Change and Health Equity and HHS to develop the Climate and Health Outlook, which was created to inform health professionals and the public on how our health may be affected in the coming months by climate and weather events, and to provide resources to take proactive action. NIHHIS worked with the NOAA Viz Lab and NOAA's Office of Education to create a virtual reality urban heat island experience, which I recommend you all take a chance and look at. It's really a kind of a revolutionary capability, and it allows people to visualize Washington, D.C.'s heat island and learn about what can be done to mitigate it. Climate Health Equity Fellows, for the first time at NOAA, We're co-sponsoring a cohort of CHEF, Climate Health Equity Fellows, medical doctors serving underserved populations. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity education, advocacy, and policy solutions. NOAA is a leader in this space, but we can't do it alone. And we're honored to work with our federal partners at the CDC, including NIHHIS, EPA, the Health and Human Services Office of Climate Change and Health Equity, the Substance Abuse and Mental Health Services Agency, FEMA, OSHA, USDA Forest Service, the Veterans Administration, and recently HUD. NIHHIS and NOAA are working to strengthen relationships with the private sector and service providers. For example, ESRI. Heat.gov was created in collaboration with ESRI, a global leader in geographic information systems. We're partnering with Kappa Strategies, and we've been doing so for the last 7 years for urban heat mapping. It's important for us to work together globally, to learn from each other, and change how and what we do to tackle this heat problem faster, better, together. Toward this end, not only has NIHHIS and NOAA mapped the urban heat islands of U.S. cities, but for the first time this year, we mapped 2 international cities, Freetown, Sierra Leone, and Rio de Janeiro in Brazil. Additionally, we'll be mapping a 3rd international city, Santiago, Chile, later in 2023 or early 2024. NOAA has also engaged with the UN representative body for meteorological services, with whom we helped launch and lead the Global Heat Health Information Network. This work is based on the NIHHIS model and serves to galvanize institutions and governments globally to address heat risk and improve heat resilience. This GHIN network, the Global Heat Health Information Network, is currently updating the heat health early warning system, the guidance for that, and is leading the heat and health activities under the UN Secretary General's goal of early warning systems for all. Next year, I hope to be able to speak to you about continued progress on advancing heat equity and justice. NOAA has launched a series of climate and equity roundtables throughout the country. 4 of the 8 regions had heat as a priority: Las Vegas, Phoenix, Charleston, and Miami. In addition to continued collaboration with those cities, we plan to work with other regions and communities to map, understand, and help plan for and reduce heat risk in communities and for disproportionately affected populations. In fact, we look forward to doing this with our partners in the Veterans Administration to address heat risks to our veterans as well as others. NIHHIS will enhance the information and tools available on heat.gov starting now, with lessons and resources gleaned from this meeting and developing new products over the course of the year to launch by next summer. Working with our interagency partners, we will run a heat awareness social media campaign over the next several months with the goal of reducing heat-related health illness and death. 5 research projects focused on building urban heat resilience and funded by NIHHIS are wrapping up this summer, and their results will be shared via an upcoming webinar series, again, available on heat.gov. And you'll see evidence of progress on this through NIHHIS National. Progress, but not by no means done. We'll have a lot of work still to do to make a heat resilient nation, and it takes all levels of government, including Congress, to make this happen. So thank you again to the organizers, the Environmental Health Nexus team at CDC for hosting this Zoom platform, the NIHHIS Interagency Committee, and the NIHHIS National Steering Committee. With that, thank you again, and I'll turn it back to Julie.
Dr. Spinrad, thank you so much for your time and your enthusiasm. And there is one more role, which I purposely didn't say, but that you also co-lead in the context of this administration's priorities. There was established an extreme heat working group from the White House. So Dr. Spinrad is one of the leads, along with the Environmental Protection Agency and Health and Human Services. That group is actually hosted and led by Kristen Averett from the White House. So we are really pleased to have Kristen join us today. So NIHHIS is one way in which the White House Interagency Group is delivering the goods, if you will, for the U.S. government. And we're pleased to have Kristen to say a few words as well. And thank you for joining us this morning. You have a whole panel this afternoon, which will be talking about sort of other federal capacities. But Kristen, thank you for being here, and thank you for the administration's leadership on the importance of heat.
Indeed. Thank you so much, Julie. And I have to say, of course, thank you to Dr. Spinrad for all of your leadership on NIHHIS and for everything that NOAA does to help our nation navigate the impacts of climate change and the growing risks of extreme heat. And as somebody whose hometown is Las Vegas, I can just tell you a dry heat only goes so far. So I also must extend my thanks to EPA Administrator Reagan, as well as Secretary Becerra, for embracing the Biden-Harris administration's whole of government interagency approach to addressing climate change issues. The work and collaboration among NOAA, the EPA, Health and Human Services, and so many other agencies on extreme heat through NIHHIS and through the HEAT Interagency Working Group really demonstrates how much stronger and more effective we can be when we work together. As an example, just last week, the U.S. Forest Service announced the deployment of $1 billion for urban tree canopy and greenscaping programs. And to support the communities that are looking to secure those resources, the HEAT Interagency Working Group collated a suite of database planning tools that can be used to assess heat risk. And this was released as a White House fact sheet. And that's just one of so many examples of where successful interagency collaboration is really helping people on the ground. And I truly look forward to hearing more during this week about everything that NIHHIS has accomplished in the last year and where they intend to go in the future. Protecting our communities, households, and the workforce and our most vulnerable populations from the danger of heat and other impacts of climate change, it's really a priority for this administration. And fortunately, we do have the bipartisan infrastructure law, as well as the Inflation Reduction Act. They really offer unprecedented opportunities for us to invest in the programs, projects, and the people that can help us to build resilience to extreme temperatures. As everyone here surely knows, like most climate impacts, historically marginalized and low-income communities are the most vulnerable. And just last week, the president signed a historic executive order embedding environmental justice into the work of federal agencies to achieve real measurable progress that our communities can count on. So thank you to everybody here, federal agencies, academia, private sector, on behalf of the White House, for the important work that you're doing to hone the observations, the projections, and the risk assessments and responses that we really need to build our resilience to extreme heat. Thank you, Julie, and thank you to everybody here for all of your work.
Well, I think it's a amazing thank you to you, Kristen, for your leadership and for the Biden-Harris administration's focus on extreme heat. Really, we've been around for a while working on this issue, but having the elevated recognition of heat as a priority has made a huge difference. So thank you to you for sort of spearheading this for our nation. Thank you to all of the NIHHIS agencies, actually, who've been at the table for a while. It's really nice to have the work elevated and to be able to help deliver. And then to Dr. Spinrad, Administrator Regan, and Secretary Becerra for actually leading the effort on our collective behalf. So thank you so much for being here and for being with us. And you have a whole panel later, so it's a nice open and close of the day to have you now, and then to be able to do a deep dive on the on all of the work that we're actually doing across the federal government at the end of the day. So thank you very much for being here. All right, so that was really actually very exciting. It's quite an honor to have the administrative level and the White House involved, and to really, I hope that you are all seeing the recognition of heat as a problem in the United States and our role that we can play internationally as well. At this point, I think we will let Dr. Spinrad come back on, and he has a long-standing relationship with Congresswoman Bonamici, and one of the issues that, as many of you know, we have with heat is a governance issue. And so while NIHHIS has developed a strategic plan, we have agencies involved, there is not a legislative mandate or priority that actually authorizes this. So we are really thrilled to have Senator Markey and Congresswoman Bonamici actually providing input, introducing legislation in the previous Congress. We understand from rumor has it that it might be introduced again, but we actually have some remarks from Congresswoman Bonamici coming up. Dr. Spinrad, would you like to introduce her? I know you have a long-standing relationship with her. Might be gone. So let's just go on to Congresswoman Bonamici's remarks, if you wouldn't mind. There we go. Thank you.
Hello, I'm Congresswoman Suzanne Bonamici, and I represent Northwest Oregon. I'm glad to be with you today for the second annual NIHHIS national meeting. Thank you to NOAA for inviting me to join you for this important conversation. In Oregon, we know the devastation that can be caused by extreme heat events. In recent years, these events have increased in frequency and intensity. During the record-breaking 2021 heat dome event, temperatures reached 118 degrees in areas of the Pacific Northwest, and even hotter in urban areas without a canopy. And for days, hot air remained trapped over the region. Like many places across the country, the Pacific Northwest is not built for this kind of heat. Many of my constituents do not have air conditioning. For those living outside, conditions were even worse. More than 90 people died in the Pacific Northwest. The communities that felt the hottest conditions fell along socioeconomic lines. In Portland, 4 zip codes in the eastern part of the city accounted for about a quarter of the reported deaths. East Portland neighborhoods are poorer, more diverse, compared to Portland's west side and central neighborhoods. And neighborhoods on the east side are also more densely covered by heat-trapping concrete and cement and have 26% less tree canopy than neighborhoods west of the Willamette River. Workers bore the consequences of extreme heat differently, depending on their workplace. Sebastian Francisco Perez, a farm worker who came to Oregon from Guatemala, tragically died on the job during the heat dome, the day after his 38th birthday. And he was not the only worker who died because of unsafe working conditions. These were preventable deaths, and in the face of our changing climate, we must do more so people in the country no longer suffer and die from the consequences of extreme heat. The National Integrated Heat Health Information System program is a powerful tool in our effort to identify and mitigate the dangers and the injustices associated with extreme heat. I was thrilled to hear that this year's slate of urban heat island mapping campaigns includes Washington County, Oregon, which is at the heart of the district I represent. Projects like these involve the community in a collective effort to map hotspots that can be up to 20 degrees warmer than the areas surrounding them. Data from these projects help us to provide help to the people who need it most and continue the slow arc toward environmental justice. In this Congress, I am leading the Preventing Heat, Illness, and Deaths Act, originally introduced by my former colleague, Charlie Crist. This important legislation would provide the National Integrated Heat Health Information System with more capacity to respond to the increasing risks of extreme heat. We'll also create a committee in the White House Office of Science and Technology to coordinate federal actions on heat-related risks among agencies. We know that these risks are not going away, so it's imperative that the government provide all the necessary resources for our communities to stay safe. So thank you again for inviting me to speak. I hope you have a productive annual meeting, and I look forward to continuing to partner with you on these important efforts.
Right. Thank you, Congresswoman Bonamici. We're very fortunate to also have remarks from Senator Edward Markey of Massachusetts to speak about heat legislation he introduced in the Senate. The Preventing Heat, Illness, and Deaths Act, introduced in 2021, would authorize NIHHIS to prepare the nation for the threats of extreme heat and protect communities that are disproportionately impacted. Senator Markey will speak more to the role that NIHHIS plays in addressing heat and health. Senator Markey.
Hello, everyone. I'm Senator Ed Markey, and I want to thank you for the opportunity to join you at this year's National Integrated Heat Health Information System National Meeting. As the climate crisis continues to accelerate, extreme heat in the United States and events associated with it are becoming more frequent, longer lasting, more severe, posing a deadly and dangerous threat to Americans. We know it's happening. We know why it's happening, because we know that extreme heat can cause heat exhaustion, heat stroke, even heat death, resulting in part from the practice of historic redlining. The risks of extreme heat have fallen more heavily on low-income communities and communities of color, with fewer trees and more pavement in their neighborhoods, as well as less access to cooling technology. These groups are more exposed to the dangers of extreme heat. And while most heat-related deaths and illnesses are preventable through outreach and through intervention, extreme heat events have been the leading cause of weather-related death in the United States of America over the last 30 years. That's unimaginable. And we're just going to have to do better at protecting vulnerable communities from this threat. This is a national problem, and it requires a national response. These communities need help. And it's why I'm so grateful for all the work that you are doing to understand and create responses to extreme heat, because you're bringing experts and stakeholders together to leverage the best available science to better protect us from the health risks of extreme heat. I'm fighting in the Senate to ensure that you're going to get the resources, the funding, the support that is needed for its critically important work. And that's why I'll be reintroducing the Preventing Heat, Illness, and Deaths Act alongside Congresswoman Suzanne Bonamici in the House. The Preventing Heat, Illness, and Deaths Act would help strengthen the nation's ability to cope with rising temperatures by expanding upon the ability of NIHHIS to fill key information gaps and directing resilience funding to communities that need it the most. By supporting and building upon the great work that NIHHIS is doing, we can save people's lives in the face of deadlier and more frequent heat waves. And we need to act now. I want to thank the entire team for all that they're doing, and I look forward to continuing to support your critical work. Thank you for everything that you are doing.
Thank you, Senator Markey, for leadership, both in the House and the Senate. It's exciting to have their participation and have their support. So I hope you all see a great setup in terms of administration priorities, of federal leadership, congressional leadership. This is all very good to help us address heat better in the United States and with our partners. In the course of the next couple days, we can't cover everything. There are some things, as Paul mentioned earlier, we're not going to cover international. We're going to do that separately. We can't cover communications in depth. We can't cover enough of it in depth. But what you are going to get is an amazing lineup of speakers that are going to cover some disproportionately affected populations, a little stage setting on day one. Day two is a little more focused on the science and innovation and research component. And day three is more focused on state, territorial, state, local, territorial, and tribal populations and what they're doing and how we can learn from each other. So I hope you are as excited as I am to kind of hear all the talks. It's been a lot of fun to put it together, a lot of work to put it together. I just want to learn for the next couple of days. So Paul, over to you.
Yeah, thanks, Julie. So now we'll begin the sessions of NIHHIS National. To kick off the meeting, session one is defining the problem. This session will really set the stage for the meeting with overviews of the problems of heat. So I want to welcome my colleague, Dr. John Belbis, the moderator for this session. Dr. Belbis is the director of the HHS Office of Climate Change and Health Equity, or OCHE. He's a physician and a public health professional with over 25 years of experience working on the health implications of climate change. And he served as HHS principal to the U.S. Global Change Research Program and was former co-chair of the Federal Climate Change and Human Health Working Group of the U.S. Global Change Research Program. Over to you, John.
Great. Thank you so much, Paul and Julie, and welcome everybody. It truly is an honor to be in this position of kicking off our sessions. I'm totally excited about this first session on defining the problem. Now, why are we starting out with heat defining the problem. I mean, I can tell you that heat is by far the best researched climate health issue. There's tons of literature. Why do we need to start here after all these years? Don't we know what the problem is? And I'll just set a stage by saying, you know, in a very straightforward way, I think the answer is very straightforward, that heat is a short-term, long-term, simple, compounding, mundane, and unprecedented and catastrophic issue. And that's why we have to define it, short-term and long-term. We see this, you know, tension between a heat wave that's happening in hours and dealing with climate change and ever-growing heat, especially when we look at the solutions. And the solutions and defining the solutions that we need change as you move from emergency response to longer-term planning. So we have to define the problem of heat differently depending on the time scales. You know, housing and energy solutions have to, you know, place the most need to consider temperature extremes. And then you bring in architecture and urban planning, and heat then has to be considered in the context of also cold or floods or wind resistance or wildfires, depending on where you are. Simple or compounding. So, you know, with climate change and increasing extremes and other threats in this world of ours, like pandemics and cybersecurity, heat has to be considered in the context of how it can compound problems, like a grid shutdown or a power failure after a hurricane. So there's a simple aspect to it. Yes, the temperature goes up. We have a heat wave. People are exposed to heat. But so many times, and we've seen this with the pandemic, heat is compounding something else that's going on. What happened in, you know, in New Orleans after the hurricanes, the way the wildfires in the Northwest compounded the heat waves, et cetera. And also of really critical importance, heat is often compounding non-climate or environmental stressors, especially in overburdened communities, including environmental stressors like air pollution or social and economic stressors like discrimination. And so heat is also in this context, as Dr. Walensky mentioned, as Administrator Spinrad, of being a very important environmental justice issue and an important issue in addressing basic health disparities and health equity. And then, you know, the mundane versus the catastrophic. So heat is an everyday issue. You know, in many places in the summer, it's hot every day. And the fact is that the bulk of the mortality from heat occurs when it isn't a really extreme heat day, just because they happen more frequently. And, you know, we've talked about the disasters, but even extreme heat doesn't damage enough property to trigger a Stafford Act disaster declaration. So we have this aspect that heat's an everyday issue. We have to deal with it at the clinical level, at the emergency response level, at the community services level, because it's everyday. But then, as happened in the heat dome in the Northwest, we have these unprecedented heat waves in places without the infrastructure. So there's a lot to discuss, and I'm looking forward to the session. Our Office of Climate Change and Health Equity is trying to marshal the resources of HHS to address heat, as has been discussed a little bit, and we address the different aspects of it. So part of it is giving clinicians the tools they need with a guide to be able to refer patients to resources. We're supporting the Administration for Children and Family in opening up LIHEAP for cooling costs, and we'll talk about more about that. We're working with the Center for Medicare and Medicaid Services to use waivers and flexibilities to be able to support the purchase of air conditioners, and we'll talk more about that as well. And we've mentioned the Climate Health Outlook, which tries to look at these timescales and put heat in the context of vulnerability indicators. So with that, by way of introducing and setting the table, it's a real pleasure to turn the session over to Dr. Chris Ebi, who will be joining us through a pre-recorded video. Dr. Ebi is a professor in the Center for Health and the Global Environment at the University of Washington. Dr. Ebi has been a leader in the field of climate change and health adaptation for decades, leading research efforts, leading countries in their efforts to develop and implement adaptation plans throughout the world, throughout cities in the United States, Canada, Europe, Africa, Asia, and the Pacific. So it's a pleasure to introduce Dr. Ebi's video.
Hello, I'm Christy Ebi, a professor in the Center for Health and the Global Environment, University of Washington. I'm joining you today from Bangkok, Thailand, where it was 100 degrees Fahrenheit today. The humidex was 129 degrees. So I'm here to talk with you about heat and its impact on our health and well-being. People are unnecessarily suffering and dying in the heat. The figure on the left shows you what happens physiologically when our core body temperature rises above its natural limit. We've got a pretty narrow range within which our core body temperature effectively protects our cells and our organs. We have behavioral mechanisms, going to find some shade, physiological mechanisms such as sweat, to protect ourselves in the heat. When those mechanisms are insufficient, then our core body temperature rises to the point where it starts affecting our cells and our organs. After a heat wave, when there's an analysis of excess deaths, about half of all those excess deaths are due to cardiovascular causes. These are people who died, for example, from a heart attack, who would not have died otherwise. And it's not just mortality. There's excess hospitalizations. There's impacts on occupational health and productivity. In sports, there's injuries and illnesses. Some adverse pregnancy outcomes are increased in the heat. And we know that our physiological limits are finite, and there's a range of factors that can increase or reduce those limits. We're concerned about this because climate change is going to continue to increase heat-related morbidity and mortality without urgent investments in research and in risk management. I'm also supposed to address the economics of heat. The health sector's been pretty poor at this, but by and large, we know that hospitalizations and deaths are much more costly than the investments that are needed to protect our health and our well-being in a warmer climate. There are a range of heat illnesses that people can experience, from mild heat rashes, many people have had those, all the way up to heat stroke. Heat stroke is a medical emergency. Mortality could be as high as 25%, and people who survive often have lifetime consequences. In addition to these illnesses, there's a range of associated syndromes listed on this slide. So you can see that heat has multiple impacts that negatively affect our body when the exposure to temperatures is too high. We all know that climate change is affecting our temperatures. This is a recent index put together by Climate Central called the Climate Shift Index. Shows you for summer days in 2022 how temperatures shifted around the country. These are just for the highs. And importantly, the lows also are increasing. We know that when people have experience of a very hot day, if they can't cool down at night, they don't have time to get that core body temperature back down, then mortality rises. We also know that mortality is higher when the heat wave occurs earlier in the summer. People are less ready for it physiologically and in terms of how we prepare for heat wave early warning systems. So there's a lot of knowledge about what needs to be done to protect us in the heat. This heuristic was put together quite a few years ago to show a shift in our normal temperature pattern to the one we're in, and there'll continue to be shifts into the future. The observations, though, tell us that this heuristic isn't quite accurate. What's being observed is that the curve, the temperature curve, is being pushed down and being pushed out further to the right. So the increases in extreme heat are much larger than what this figure would suggest. The Intergovernmental Panel on Climate Change has concluded for the last several rounds that climate change is increasing the frequency, intensity, and duration of heat waves. People then are being exposed to those heat waves. These data are from the Lancet Countdown, just for children under the age of 1, adults over the age of 65. And you can see the trend from 1980. And you can see the numbers. In 2020, compared with a long-term average, adults over the age of 65 experienced 3.1 billion more person days of exposure. Those exposures are unevenly distributed. This table shows interactions between extreme heat, race, ethnicity, neighborhood, and the concentration of extreme events. A particular issue in the United States, of course, is redlining. Redline districts are hotter than the surrounding area, in part because trees were not planted there, and so they have less land cover to help protect them when the temperatures are high. The US, as in all other parts of the world, is seeing a large increase in very extreme heat waves. The Pacific heat dome occurred almost 2 years ago. You can see the temperature records in places of the Pacific Northwest were broken by more than 10 degrees. For those of you who follow weather, you know that often we break temperature records by tenths of degrees. It was very unusual to have temperature records broken by this amount. A detection and attribution study concluded that this event was virtually impossible without climate change. The numbers are just in for the state of Washington. Overall, there were more than 700 excess deaths associated with this event. These are 700 people who died from climate change. People who died, for example, of a heart attack who would not have died from one otherwise. There's been heat waves with even larger associated mortality, and there's heat waves with even more extreme temperatures. Those are going to continue to occur with greater frequency as we go into a warmer climate. The Working Group 1 contribution to the 6th assessment cycle of the IPCC put together these projected changes in heat extremes for 1 in 10-year events, 1 in 50-year events. The baseline is 1850 to 1900, and you can see in the present day climate, at the time the slide was put together, was 1 degree C above pre-industrial. We're already at 1.2 degrees. And you can see that the 1 in 50-year event is already occurring 5 times more likely. And these changes, again, are associated with mortality. The modeled estimate is that about 12,000 Americans die every year from the heat. These projections take annual heat-related mortality out to the end of the century under 4 scenarios. The top row is no adaptation to rising temperature. The left column is under high greenhouse gas emissions. The right column, low greenhouse gas emissions. And the bottom row is adaptation. The figure shows you deaths per million per year. And just compare the top left to the bottom right. Those are 2 very different worlds. This is a compelling figure of why it's so important that we have urgent and immediate investments in adaptation and in mitigation so that we can reduce as many of those deaths as possible. There's many factors that either increase or decrease vulnerability to heat-related mortality and morbidity. And this deep knowledge can then be used in constructing heat wave early warning systems. And when doing so from the health side, we can think about actions that reduce the exposure to high temperatures, for example, using fans. Actions that will prevent the onset of illness once people are exposed, when you can't reduce the exposure. The example here is remaining hydrated. And finally, actions that ensure people have access to the medical care that they need. Health obviously is central for developing heatwave early warning and response systems. But as you can see, for this figure from the Heat Action Plan for England, there's lots of other actors that need to be considered at all scales. You need to think at the local level, the local health departments, the local meteorological services, but also people who service elderly care institutions, for example, people who work with the unhoused. And so putting together a system requires an all-of-government kind of approach. One level in there is the National Integrated Heat Health Information System. I'm sure you're going to hear lots more about that during the presentations over these couple of days. And this is an advertisement for some events they have coming up in May to help increase awareness about heat and make sure that we're better prepared this summer as the temperatures go higher. And finally, I'd like to end with heat is an all of society problem. I focused on health, but also there's critical impacts on environment and on our infrastructure. And being more effective in promoting people's health and well-being in a changing climate is to look at those interactions and how best to intervene. Thank you for listening, and I look forward to the discussions.
That was a wonderful presentation. Thank you, Chris, wherever you are, if you're still in Bangkok. And let's move on. It's my pleasure now to introduce Dr. Kazuhiko Ito. Dr. Kaz Ito is the Executive Director of Environmental Research at the Bureau of Environmental Surveillance and Policy at the New York City Department of Health and Mental Hygiene. He conducts research to investigate the adverse impacts of weather and air pollution on morbidity and mortality in New York City, and he is interested in generating information that is useful for New York City's equitable climate change adaptation planning. So very much welcoming Dr. Kaz Ito, who will help us bring together these issues of health impacts, health equity in the reality of a complex city. Thank you, Dr. Ito.
Thank you, Dr. Balbas. I'll be talking mostly about mortality in New York City, but I'm sure the situation is generalizable to other cities with urban heat island and disparities in health. Sorry, next slide, please. So here I'm showing you the daily counts of natural cause deaths, heat stroke deaths, along with the temperature. This is 2006 heat wave event. There are two types of deaths associated with heat stroke deaths, shown in the purple color. That is the external cause of death, and cause of death is recorded in the death certificate. Typically, we have 7 to 10 heat stroke deaths per year, per summer. But the impact of heat is not just on the heat stroke deaths. The top series, natural cause of death, you can see that large increase as seen on heat wave days. And in general, for the extreme heat temperature range, we observe about 10 times more heat exacerbated natural cause of death compared to the heat stroke deaths. But what's important is that even during the non-extreme heat days, we see associations between temperature and natural cause deaths. So the total impacts, if you count the exacerbated deaths above the median temperature of 82, we are talking about 350 deaths, excess deaths per year in New York City. Next slide, please. Here we looked at, after that 2006 event, we focused on the cause and characterization of the excess heat. We conducted time series analysis of temperature and natural cause deaths. And here I'm showing the lagged 1 day effects, mortality risk ratio. So the dotted lines on the about 105 maximum heat index was the previous heat advisory threshold. And because we saw mortality increase well below that threshold in 2008, we worked with the local National Weather Service and Office of Emergency Management to change the heat advisory threshold down to 95 degrees maximum heat index of at least 2 days, or 1 day of 100 degrees. And in this context, in 2020, New York City Council passed a legislation requiring the health department to annually report heat stroke deaths and heat exacerbated natural cause deaths, and update on heat vulnerability index that I will talk about later. Next slide, please. Heat stroke death records are quite important in characterizing the conditions that are associated with heat stroke. Based on the review of this records, we find that about 70% of heat stroke deaths occur at home. And they are essentially all associated with the people who lived in apartments with no AC or no working AC in use. And you can imagine that being able to run AC or not having AC has to do with the income. Next slide, please. Now, so we annually report the relationship between temperature, daily maximum temperature, and cumulative relative risk. Cumulative meaning that when you have a high heat, we can observe the excess deaths up to 3 days after that event. So we are talking about in the high temperature range, up to a 20% excess compared to the baseline. And if you can look at the bottom of this figure, you see that short vertical lines, and those are the data densities, number of days. So almost by definition, for extreme heat days, we have about 10 days per year. And of course, the relative risk is high in that range. But if you look at below that heat advisory threshold, and between that and median temperature, you also see a relative risk slope there. And because there are more days in that range, non-extreme hot days, the total contribution from that non-extreme hot days to the overall heat exacerbated deaths is much larger. So for extreme heat days, we see about 100 deaths per year. But if you look at temperature above 83 degrees, we have about 350 excess deaths. So there are more excess deaths coming from that non-extreme hot days. The data is available from this link I put it. This was from the 2021. That's the first year of our heat report. We're gonna produce the next one in this June. Next slide, please. So it's not required for us to characterize the temperature trend, but as part of the first year of heat report, we also showed that how the temperature has been changed in the past 50 years. It's a rather busy slide, but if you look at the top left, that's the daily maximum temperature distribution, how it changed compared to 1971 to 1980 versus the past 10 years. You can see the shift in the distribution of temperature, and that is the daily maximum. The one below it is the daily minimum temperature. Essentially, that's a nighttime temperature, and the way it's shifted is different from the daily maximum. And if you look at the right side of the panel, this is the y-axis is the number of days in certain temperature ranges. The bottom part is I'm showing you the daily maximum, the high range of the days above 95 daily maximum or days above 78 daily minimum. So they are increasing, but compared to that magnitude of increase, if you look at the top part, the blue one is the daily minimum temperature. That is number of days increased from something like 50 to more like 70 days per year. So nighttime temperature is basically increasing faster. But the orange one is the hot but not extreme hot days. That number of days per summer increased something like 45 to nearly 60 days. So you can imagine that the total contribution to the heat exacerbated deaths per year is coming from this increasing number of hot but not extremely hot days. This is also available from our heat report. Link is there. The next slide, please. Another element of this heat vulnerability is the, we worked with the Jamie Madrigano around 2014. she ran the case-only analysis to identify individual and neighborhood level risk factors. And the right side, the left side shows the heat vulnerability index, which is derived from this AP analysis, case-only analysis. We identified percent poverty, percent non-Hispanic African Americans, and percent green space, and high surface temperature. They all contribute to the heat exacerbated deaths. And on the right side, I'm showing you the lack of air conditioning, and they match up. So later on, we included air conditioning prevalence as part of heat vulnerability index. So New York City, citywide, we have about 90% air conditioning prevalence, but in certain neighborhoods, prevalence is lower than 80%. This map helped the city come up with the Cool Neighborhoods initiatives that includes the planting street trees in these high heat vulnerability index neighborhoods, as well as the pilot project to hold the outreach program. Next slide, please. We also run this syndromic surveillance on heat-related illness emergency department visits. So we have syndromic surveillance system, and we received previous days heat-related illness ED visits. Initially, we used that chief complaint, but now we are using the physician diagnosed causes to count the daily counts from the about 53 emergency departments. And during the warm season, we run automated prediction models. And when extreme heat is forecasted, the city emergency department, Office of Emergency Management convenes the heat emergency steering committee calls. And we look at this observed by versus predicted. And if the observed is much larger than predicted, we report that alert in the emergency committee calls. And this heat-related emergency ED visits is also a good predictor of excess deaths. You can run the model, and this heat-related illness emergency visits is a good predictor of the excess deaths beyond just temperature alone. Next slide, please. So as you saw, we tend to focus on extreme heat events, and that, of course, that's important, and outdoor activities and workers outside and so on. But heat exposures related to mortality often happens, mostly happens indoors with no air conditioning. So 85 degrees outside temperature can mean like 92 degrees inside. So that's the main issue here. So I know air conditioning can be vilified in the global scale, but in a city like New York City, where the lack of AC has to do with income, policy decision needs to focus on keeping the indoor temperature safe, and that requires air conditioning. And also, people need to run the AC, and so we have a strong energy and utility assistance program. And to make this really systematic, we need indoor temperature, maximum indoor temperature threshold guidelines developed. And because air conditioning uses energy, we do need cheaper, energy efficient air conditioning. So I think the situation here in New York City is applicable to other cities, and the focus has to be on disparity of the heat impacts. Thank you.
Thank you so much, Dr. Ito, for a really rich and you know, place-based and making it real for New York City, but as you have said very eloquently, providing an example that really is generalizable for how cities need to be thinking about heat, as you know, as we laid out at the beginning, as an issue of equity, as an issue of the built environment, as an issue both for the extremes that occur, but also what do we do about the bulk of the mortality that occurs on the non-extreme days. So thank you very much. It's now my pleasure to introduce our third speaker, and before I do that, I'm just going to say we don't have a formal question and answer time, but please do put your questions in the chat. I know the speakers are doing everything they can to answer them in real time within the Q&A function. Our final speaker is Brendan Haggerty. Mr. Haggerty manages the Healthy Homes and Community Teams at Multnomah County Health Department, which is where Portland, Oregon is located. This is an environmental health program that spans everything from lead poisoning, air quality, the Portland Harbor Superfund site cleanup, climate and health, and the built environment. Previously, he served as the epidemiologist for the Oregon Health Authority's Climate and Health Program and Health Impact Assessment Program. Over to you, Brendan.
Thanks so much, Dr. Balvis. Hello, everyone. My name is Brendan Haggerty. I'm joining you from Multnomah County Health Department, which is the local health department for Portland, Oregon. As Dr. Balvis said, I manage the team at the health department that focuses on health impacts from climate change. And in 2021, we experienced those impacts to a truly dramatic extent. For a few days in June, life stopped as we experienced high temperatures never before documented in this part of the world. Today, I'm going to share that story from the perspective of someone responding in the local health department. Next slide. I'll start by getting us oriented to the people, the place, and the climate just a little bit. This is my home and my community. Multnomah County sits at the northern border of Oregon, at the confluence of the Columbia and Willamette rivers. It's geographically small, but home to about 820,000 people living in Portland and the nearby suburbs. This is a beautiful corner of Oregon, but it's had a rough few years when it comes to climate hazards, experiencing record wildfire smoke in 2020, and of course, the 2021 Pacific Northwest heat dome that we'll talk about today. The next slide. Our county shares a name with Multnomah Falls, just a few miles east of the city. And I think this is what a lot of people think of when they think of the climate here. It's lush, mild, and temperate. Hot weather is pretty unusual for us. Over the past few years, notwithstanding 2021, we've averaged just a few days a year when temperatures get above 90 degrees. Air conditioning is far from universal here. In the metro area, it's an estimated 1 in 5 homes do not have air conditioning, and that gets much greater in certain neighborhoods. And for us, the typical extreme heat event occurs every year or two, might look like a couple of days when the temperatures hit the triple digits. For most people, hot weather might mean a trip to the movies or a swim in the river, but not a trip to a mass shelter. In most years, there are 0 heat deaths in Multnomah County. Before 2021, the highest count in the past 20 years was 2 hyperthermia deaths in 1 year. So we don't have a long history of dealing with heat, but it's not as if we didn't see extreme heat coming. And I wanted to share about our preparation with you today because it's part of a cautionary tale. We had some preparation in place and we still ended up with pretty severe impacts. So thanks in part to some funding from CDC's BRACE grants in the past, we've had plans on the books for years identifying extreme heat as a climate hazard. We have a standard operating procedure for extreme heat events with risk-based thresholds and a menu of evidence-based interventions. We have communications infrastructure with a dedicated web page for heat events and an interactive map of cooling spaces. We also have an internal dashboard set up for syndromic surveillance, just like Dr. Ito was discussing for New York. So we can see in real time the visits to emergency room and urgent care clinics. Even though we had all these things in place, they weren't enough to prevent the severe impacts we saw in June of 2021. Next slide. What happened during the heat dome was so anomalous. It shattered all-time heat records by something like 9 degrees Fahrenheit, or as Dr. Ebi mentioned earlier, it was even greater in some areas. It reached 116 degrees in Portland. The series from NOAA shows just how quickly and extremely the temperature changed. And as Dr. Ebi mentioned, we've had a number of attribution studies that link this event strongly to climate change. And I've heard climatologists and atmospheric scientists describe this event as impossible without climate change, but also impossible with climate change. That's how far outside the norm this was. On the next slide. I'll stay on this slide for a few moments to just give you a chronology of how the event unfolded. A critical piece that I want to convey is that the forecast was consistently revised upward. When we began outreach on Monday, June 21st, the Weather Service was forecasting only a 20 to 30% chance of temperatures over 105 degrees. So we mobilized expecting something closer to the garden variety heat wave that we experience once or twice a year, rather than the record heat that we got. When we fully activated on Wednesday, June 23rd, the Weather Service had just issued an excessive heat watch to begin on Friday. On that day, the 23rd, we convened a coordination call with 144 organizations and jurisdictions, everyone from first responders to housing providers to transit agencies and utilities. So it got as close as we could get to that all of government response that Dr. Ebi mentioned. On Thursday, the 24th, the forecast was revised significantly, now with a record high of 109 degrees forecast for Sunday. With this revision, we decided to open libraries as cooling centers, in addition to the convention center and the community centers that we'd already identified. By Friday, the 25th, it was hot. We opened cooling centers and we learned that temperatures expected on Sunday would be repeated again on Monday. On Saturday, the all-time temperature record was broken for heat. We gained support from the Red Cross in staffing and supplying our cooling centers. Sunday, we broke the record again, hitting 112 degrees. We opened additional library branches and as cooling centers. By Monday, the 28th, when we set what would become the new all-time heat record of 116 degrees Fahrenheit, the life of the city was seriously altered. Permits for activities in parks were canceled. The pools were closed because the decks were too hot. Trains stopped running because the overhead cables and tracks could not be operated safely. Nighttime lows remained high on Tuesday night, and we finally closed our cooling centers on Wednesday, June 30th. The next slide. Our response to this event was unprecedented. We used every intervention in our plan and improvised others on the fly. We had warning messages translated into many languages and distributed through as many channels as we could think of. The Parks Bureau canceled permits for outdoor events, and our transit agency, TriMet, transported people to cooling spaces for free. For the first time ever, we opened 24-hour cooling shelters, recognizing that nighttime lows in the 70s and 80s would not provide adequate recovery. These shelters were resourced with behavioral health specialists, food, pet accommodations, and COVID vaccinations. Anyone who needed transportation to a shelter could get a free ride on transit or call 211 to arrange a ride. We ultimately sheltered 1,400 overnight guests and provided 6,000 meals. This was paired with an incredible amount of direct outreach to our most vulnerable populations. Our case managers were working furiously to check on older adults and people with disabilities. We had 100 street teams conducting outreach to people living outdoors, distributing cooling kits, water, and cooling towels. And we made a special effort to contact multifamily buildings and work with property managers to ask them to open cooling spaces despite the fact that our messaging had for 18 months had been to avoid congregating indoors. The next slide. Despite this, the health impacts were swift and severe. This time series shows emergency department visits for heat illness during summer of 2021. You can see the dramatic spike during the week of the heat dome. In a typical summer, we might see around 80 visits, but in those 5 days in June, we had about 2 summers worth of visits to emergency departments for heat illness. And our emergency medical services were as stressed as they were at any point during the pandemic. But there were even more severe impacts. On the next slide, you'll see that during summer of 2021, we lost 72 community members to heat. Before this event, heat deaths were almost unheard of in Multnomah County. In a typical year, we would expect 0. You can see that the highest daily count occurred the day after Portland posted a record 116-degree heat, and that our medical examiner continued to find heat death cases well into July. And then we had several more cases throughout the summer. The next slide, you'll see the groups that were disproportionately represented among the decedents. We saw that the most severe outcomes were affecting people who are older, living alone, living in multifamily buildings in warmer parts of the county. About 4 out of 5 of the deaths were among white people, and 2 out of 3 were male. When we looked at cooling type among the decedents, we found that very few had access to air conditioning. And among those that did, in 70% of cases, the air conditioning was broken or unplugged. People were also using fans, which were not effective indoors at such high temperatures. The next slide is when we cue some optimistic guitar music to talk about the positive changes that have taken place since this event and how we're becoming more resilient to heat events. We made some changes to our operations right away. We strengthened partnerships with other jurisdictions. We improved our sheltering operations. The 2 photos at the top represent this. So instead of having our emergency manager buying every paper plate on the shelves of the supermarket and stuffing it into his car, we now have a warehouse and distribution system with supplies ready to go. We also changed how we get our briefings from the National Weather Service, and they've been great to work with. Realizing that we needed to be prepared not just for the most likely scenario, but for the worst case, our conversations with them now focus on probability and the chance of extreme events. A new wave of cooling resources became available for families and households. Anyone on Medicaid in Oregon can ask for air conditioning from their doctor. And the administrators of those programs have worked to make that as low barrier as possible. The Portland Clean Energy Fund, which is a tax on large retailers in Portland, diverted part of their revenues to provide 15,000 heat pumps and air conditioning units to low-income households. That was accompanied by new programs from the state and county governments providing air conditioning to low-income families and the community buildings that serve them. We've also seen some policy changes. In the wake of the heat dome, the Oregon legislature passed requirements that new construction includes spaces that can be maintained at 80 degrees starting next year. And there's a new set of rules protecting workers from extreme heat. So today I've shared with you the preparation that we had going into this event, the impacts of it, and some of the ways that we've tried to increase our resilience to extreme heat. My hope is that you can learn from our experience and recommit to heat preparedness in your own community. Thank you.
Brendan, thank you so much. That's a fabulous presentation, and I only regret that I didn't bring my guitar into my office. We've heard it from coast to coast. We've, I think, heard the simple, complex, short-term, long-term, mundane, unprecedented nature of heat in a way that really, I think, puts it all together and sets it up for the next, for the rest of today and the next 2 days. So huge thank you to our presenters and Dr. Ebi, wherever you are. And let me turn it back now to Julie Turton. Thank you all.
John, thank you for chairing a session. The whole point of that was to just lay out a little bit of what we know are the problems that we're facing in the country, probably in the world as well. And the panel did an amazing job. And John, thank you even for your introduction. You set the stage very nicely for the rest of the sessions to come. So yeah, thank you for being here. And we'll see you in HHS a couple times throughout the agenda, because this is a really, huge active area for you as well. So much appreciated for your leadership here. We are going to transition now to some of the focus on disproportionately affected populations. We've got Maggie Gregory from the Forest Service here to talk to us and lead the panel. Maggie, are you here? Margaret, there you go. Yeah, okay. Making sure that you're on. We have 2 sessions today. So when I opened, I said there were some things that we could cover and couldn't cover. So last year, we actually didn't cover specifically disproportionately affected populations very well because we didn't have enough time. So we made it a whole focus this year, whereas we jettisoned the international discussion because we just can't have that much time. So we have 2 sessions on really understanding those populations that are most vulnerable to heat. And this is the first of those sessions. So without further ado, let me just turn it on over to you and you can introduce the amazing panelists that we have. I actually can't wait to hear from them. We have the whole afternoon session. And then just in case you weren't aware, one little plug, I think tonight, I think most of you know, because if you signed up for NIHHIS National, you'll know this, but we have a networking session afterwards. So if you haven't signed up or whatever for that yet, please do so. That's 4:15 to 5. So if there are people or questions that you want to ask, people with whom you want to speak, and we don't have time at the end of the sessions, join the networking session and you can find each other there. So thank you so much for leading the session on our first of 2. Thank you very much. Over to you.
And thank you, Julie. Hello, everyone, and it's a pleasure to be here with you today. I am Margaret Gregory, a science writer-editor with the USDA Forest Service Research and Development Deputy Area. I am thrilled to be here with you today to go into our next session, Disproportionately Impacted Populations, Part 1. In this session, we will be addressing 3 populations that are at higher risk of heat health-related impacts. While everyone is at risk of adverse health impacts from increasing temperatures, not everyone experiences heat the same. For instance, outdoor workers and athletes are at greater risk than office workers because they have increased exposure to heat. Other groups may be disproportionately affected by the effects of high heat as a result of age or poor health, or the lack of resources that enable them to adapt or recover. Identifying specific factors that increase risk for some populations gives us a way to reduce exposure and vulnerability through adaptive actions. In some cases, simply increasing awareness of the risks that extreme heat poses to health can encourage people to take adaptive actions and increase the level of attention that is given to groups that need help the most. Since this is just a 3-day meeting, we are not able to cover every group that faces higher risk of heat-related illness and death. But today, we are able to address child and maternal health, people experiencing homelessness, and redlining and inequities. In the next session, there will be presentations dedicated to different types of workers. Different populations will be covered throughout the meeting as we address varying aspects of heat and health, and we hope to continue addressing the ways in which people are disproportionately affected by heat. With that, I want to introduce our first speaker, Dr. Adele Monteblanco, to talk about child and maternal health. Dr. Adele Monteblanco is an assistant professor of public health at Pacific University in Forest Grove, Oregon. She earned her PhD in sociology at the University of Colorado Boulder and completed postdoctoral training at the University of Texas at El Paso. Her primary research and advocacy interest in the context of extreme heat is vulnerable populations. For example, her prior collaborative efforts include training community birth workers to promote heat safety to their pregnant clients during high temperatures. Most recently, she co-led an urban heat training program for youth in Nashville, Tennessee. She was part of the team to bring urban heat island mapping to Nashville in 2022 and looks forward to being part of the Washington County, Oregon heat mapping team for summer 2023. Adele's work on extreme and urban heat aims to create healthier, more sustainable, and resilient communities. Without further ado, welcome Dr. Adele.
Perfect. Hello and welcome to all those who have joined us today. My name is Adele. I'm zooming in from Oregon, and I'm thrilled to be on a panel focused on populations disproportionately impacted by heat. A big thank you to NIHHIS for including maternal health as part of this national meeting. As will be evident today, our hotter world is a growing threat to moms, babies, and families. But based on a commitment to reproductive justice, pregnant people have a right to a healthy pregnancy and healthy babies in a healthy environment. No matter what brought you to heat research or advocacy, be it outdoor working conditions, concerns for athletes, or adaptation efforts of the built environment, I promise that whatever inspired you into heat, there's a connection to maternal and infant health. Next slide, please. So environmental changes, the climate crisis, and high temperatures alike have diverse and wide-ranging effects on reproductive health, including impacts to conception and lactation. My focus today will be on pregnancy outcomes. Pregnancy is a vulnerable time for a pregnant person and a developing fetus. For those who have been pregnant, you know that the body undergoes huge changes related to hormones, metabolism, and circulation. Plus, there's just more need for hydration and nutrition. And the fetus has this incredibly complex and sequenced growth. So people with the capacity for pregnancy, as well as the growing fetus, have high needs and important biological sensitivity. There is a growing body of evidence that heat exposure during pregnancy hurts babies' health. Systematic reviews have found that maternal exposure to high temperatures are associated with an increased risk of low birth weight, preterm birth, newborn stress, and stillbirth. But the pregnant person themselves can also have poor health outcomes. Studies have found that exposure to high temperatures can increase the risk of gestational diabetes and high blood pressure. Please understand that these health outcomes can be dangerous, often create expensive medical bills, and can be quite a burden on families. And these burdens are not equal. Communities of color, particularly Black and Indigenous communities, outdoor workers, and people with low incomes are most affected by extreme heat. These are the same families that have less access to paid family leave and less access to providers from their own communities. Next slide, please. So the literature still has some really important gaps on the physiology of pregnancy and heat exposure. The details of the pregnant person's bodily response to high temperatures is still a little poorly understood. After all, every human body is unique, shaped by their climate zone and individual health conditions. And so this creates an urgent need for more research. But what do we know? We know that bodies are incredible and adaptive. Based on current evidence, scholars feel a little more confident that pregnant people are able to regulate their body temperature pretty well. But still, prolonged exposure to high temperatures associated with work or a heat wave may prompt a physiological reaction, processes like a reduction in placental blood flow, dehydration, and inflammation, which can then trigger responses like preterm birth. But importantly, our bodies exist in social, cultural, and political spaces. And the US has a maternal morbidity and mortality crisis with shameful disparities shaped by racism. Plus, the US lacks a federal paid family leave program. We have maternity care deserts throughout the country, and not all states have chosen to extend Medicaid postpartum coverage to 12 months. And I share all of this because there's a lot working against healthy pregnancies and healthy families in our country. And our hotter climate will likely worsen our maternal and infant health outcomes. Next slide, please. So we still have a lot to learn about bodily responses to heat, but we have growing evidence of the outcomes, so we need to act. What do we need to do in order to reduce this threat and protect families? Well, we need to identify a workforce that directly serves pregnant people and those who are recently pregnant. This workforce needs to be led by trusted leaders from the community with knowledge and the ability to offer wraparound services. I turn our attention to the community-based perinatal workforce, including midwives, doulas, and promotoras who offer us a big opportunity. To be clear, they cannot reduce this health impact and health inequity on their own, nor should we ask them to, but they are a necessary puzzle piece to promoting healthy pregnancies in a changing climate. For example, I was part of a collaborative team in El Paso, Texas that trained members of the perinatal workforce about extreme heat. We gathered midwives, doulas, lactation consultants together at a birth center. There, we shared the evidence of adverse birth outcomes from environmental threats And we offered outreach materials and brainstormed ways they might talk about and prepare their clients for high temperatures. Even though we were a small pilot study, I would say we were pretty darn successful. Participants reported that a short training session improved their knowledge and encouraged discussions about environmental health with their clients. At this time, many members of the perinatal workforce are massively underpaid and overstretched, but their numbers are growing. I expect we're going to see more states offering Medicaid coverage for doula care. Members of the perinatal workforce are actively seeking out information about environmental health because they see it as a risk to their clients, and their clients are asking about it. So doulas and community health workers are currently an overlooked resource in many of our communities, but that can change. We can offer them the resources to talk about heat, as well as other local environmental risks, such as wildfire and pollution. That means creating curriculum, building bridges, and inviting their expertise and their nurtured networks to your conversations on heat. They are trusted messengers and already serving pregnant people and newborns. We need to put perinatal workers in a position to provide clear, evidence-based advice to help their clients protect themselves and their pregnancy. Next slide, please. So considering the vulnerability of these disproportionately impacted populations, I want to bring attention to protective and outreach efforts. This policy and this campaign are really tangible examples to potentially integrate and adopt. So very briefly, the Pregnant Workers Fairness Act is a new law that requires employers to provide reasonable accommodations that allow workers to continue working while maintaining healthy pregnancies. Accommodations might include the ability to sit, to drink water, to have flexible hours, an additional break to use the bathroom, or to be excused from strenuous activities. This act goes into effect in June, and in this meeting's commitment to reduce risk, we need to be familiar with the law, put up posters in our office, and educate our community. The second example is an excellent campaign from the Women's Fund in Miami, Florida. And I acknowledge that city has quite a lot of resources and attention to heat, in large part because they're one of the only US cities with a chief heat officer. For the past few years, the Women's Fund has done a public awareness campaign around the effects of extreme heat on pregnant people. As part of their efforts, they have made sure both the city and county update all their extreme heat messaging to include pregnant people as a vulnerable population. Plus, they have billboards. In fact, this billboard is the first of its kind, a public health awareness effort by an NGO focused on extreme heat and the dangers to maternal health. They have a great model and they want to see it replicated in other cities. Last slide, please. I've offered some resources here if you are eager to dig in, resources like journal articles and a link to the Miami Heat campaign I just talked about. Don't panic that you have to write everything down. The presentation slides will be made available to attendees. Lastly, as you can imagine, interest at this intersection of maternal and reproductive health and heat is growing. I hope you'll join in. Thank you for your time and your future questions.
All right, thank you so much, Dr. Monteblanco. Next up, I'm going to welcome Stephen Samra. Our next speaker, Stephen Samra, MPA, Senior Associate, was Deputy Director for the Substance Abuse and Mental Health Services Administration's Bringing Recovery Supports to Scale Technical Assistance Center strategy. He has served in leadership capacities for the administration's Housing and Homelessness Resource Network, Projects for Assistance and Transition from Homelessness, and services in supporting Housing Technical Assistance Center, and has led numerous peer involvement initiatives. Stephen brings expertise in developing and leading peer advisory councils, harm reduction approaches, substance use and mental health recovery, peer leadership, criminal justice, cultural competence, promotion of lived experience as critical experiential knowledge, and effective outreach and engagement for challenging populations. Welcome.
Fantastic.
Seem to have lost Stephen. Give him a couple seconds here, and if he's not able to jump back.
Thank you. It's great to be here.
Oh,
No, you. Oh, am I back?
You're back.
Oh, fantastic. So apologies for some reason. Of course, I have unstable internet right now. Not sure why. Can we take it to the next slide, please?
Hi, Stephen. This is Morgan. You said that you weren't going to be using slides during your presentation.
Next slide. Can you hear me? I'm really
Stephen, I'm sorry, Stephen, you're getting delayed. Is it possible you could call in or possibly take your video down? And Morgan just said that you had not shared slides, so I'm just thinking that might help with the bandwidth. Go ahead.
I think you're right. I'm happy to do that. If this continues to be a problem, I'll happily call in. And I don't need the slides to talk about this this situation. What I want folks to know is that we're really aware of hypothermia, particularly when we're talking about vulnerable populations. And when I say vulnerable here, I'm really talking about people experiencing homelessness, whether it's youth, whether it's the typical age folks out on the street, or whether it's elderly individuals. The vulnerability of folks who cannot escape the heat is something we really need to pay attention to. And as I mentioned, we think about hypothermia all the time. In fact, we've got warming centers here in the Nashville area. I operate out of Nashville, Tennessee, but it's not always on our minds about hyperthermia. And we know that when, this is when the core body temperature rises too high. And we know that heat-related illness occurs when a person's body is really unable to compensate for that increase in temperature, and it can't cool off appropriately. It cools normally by sweating and evaporation, but there are some situations where that just doesn't work. And no matter how much you perspire, it's not enough to cool the body down. So when that occurs, our internal temperatures can quickly rise into the danger zone. And if we don't do anything about them, that high temperature very likely will damage brain, other vital organs, and it can even kill a person. So, excuse me, heat affects through, kind of a three-phase progression. And it starts with heat cramps. Those are painful spasms. They happen usually in your legs, sometimes in your stomach muscles. Often folks are really heavily sweating. You can see that their shirt is soaked through, their hair may be plastered to their head. These folks don't require immediate medical attention, but we should raise awareness that they're in trouble. They should stop all of the activity that they're doing outside if that's possible. We really want folks to sit quietly and do so in a cool place. And I recognize the challenge of trying to find that outside. And then, of course, fluids, as many as we can get into them. And it would be helpful if we could do something like Gatorade, something that will replace electrolytes, etc. If we move on to heat exhaustion, now we are seeing fatigue, usually pretty extreme. The sweating is still there. It's super heavy. Folks are very thirsty. They often will present with a headache. They'll be dizzy, and they often will have a very rapid breathing. Sometimes they'll feel nauseous. They'll tell you, I feel like throwing up. Their skin usually moist, and you can tell it's different. And their pulse is usually fast, and it's usually weak. If we don't treat those symptoms, the next step is heat stroke. And we can get folks cooled off if we can get them someplace where there's an air-conditioned environment, if we can remove some layers of clothing, if we can get them some cool and non-alcoholic beverages, a shower, a bath, really bring that internal core temperature down. It's gone. We no longer sweat, and the skin gets really red and dry, real hot to the touch, and you would know it. This is the tough part. The body temperature is at about 103. When this hits, but it can rise over 106 in a 911 should be called. Anyway, we can start cooling this person down right. Now we need to do extra, just fan the person back to back. Well, I'm really sorry. I don't know what's happened to internet challenges here, but we really had some disasters.
Stephen, just want to suggest that you might be able to call in, and that might make it easier.
I still apologize.
Stephen, that's okay. Thank you. Thank you so much. I will say it looks like our CDC tech team is also having a little bit of issues on their end. So I think it might be a couple different aspects that we are having here of technical issues. Stephen did send his presentation to me this morning, and I can make sure that that presentation is shared with this audience to make sure that you all are able to reference the things that he was able to speak to. But Stephen, if you're still with us, is there anything else that you want to say? Margaret, I think I'm going to turn it back over to you to introduce Dexter.
All right, wonderful. And I thank Stephen for what we were able to hear. Those technical difficulties just get you sometimes. So our final speaker is Dr. Dexter Locke, a research geography with the USDA Forest Service Northern Research Station. Dr. Locke is based out of the Baltimore Field Station. He has degrees in natural resources planning, environmental science, and geography. He conducts urban and community forest research, studying cities, trees, and the people who store them. He is generally focused on the mid-Atlantic and northeastern regions of the United States. Conducting applied research with urban natural resource managers is his passion. When not doing urban ecology, he can be found hiking, biking, and rock climbing. So welcome, Dr. Locke.
Thanks very much. Can you hear me? Can you see my screen?
Yes, everything looks good.
Thanks so much. This has been a great set of presentations. I'm really learning a lot. I'm going to talk about redlining and heat inequities. Once again, I'm Dexter Locke. I'm a research geographer with the U.S. Forest Service based in Baltimore. So when I'm asked to give this talk to an undergrad audience, sometimes this is 45 minutes, an hour, even 90 minutes. But for those who are unfamiliar with redlining, this is policies and practices starting in the Great Depression. The idea was to provide assistance and insurance to mortgages to prevent families from defaulting. And so cities across the US were divided up into neighborhoods based on their risk of foreclosure. The federal government worked with local bankers and real estate agents to appraise neighborhoods. What was deemed the safest area to insure or invest was labeled A in green and the riskiest in red, hence the name redlining for this policy. From a research perspective, redlining has a lot of interesting and convenient features. But what I want to talk about today is that it was consistent. So this was applied in a very short period of time. It was racial, which will unpack more. It's spatial. So through the magic of geographic information systems and mapping, we can add in and augment other data. Again, it was applied at the same time and was widespread across the biggest cities. And the way that the neighborhoods were categorized, this is an example from Baltimore, where I do a lot of my work. To quote the appraisal here, description: in old residential sections seriously threatened with Negro encroachments. A small section along Reisterstown Road consists of fairly modern two-story brick rows, that's short for row home. It goes on to describe the racial composition of the neighborhood. Owners of long-standing, still occupying old residences, converted apartments containing white-collar, class-skilled mechanics, et cetera. And then it provides some population estimates from the census. Favorable features: Druid Hill Park and good transportation. Druid Hill Park was designed by Frederick Law Olmsted, who famously designed Central Park, among many others. And then it says here, detrimental features: obsolescence and Negro encroachment. So quoting from the appraisal, their words, not mine. But you can see how neighborhoods were categorized a mix of race and class, socioeconomic status, building style, and age. Looking at some national numbers, about 2.75 million loans were insured under this program. Less than 2% went to African Americans, about half of which were through a special military program. And at the time, African Americans represented about 10% of the US population. So if you were Black or African American, your odds of receiving this insured loan was 1/5 of your white counterparts. So consequently, there's a lot of research today in the social sciences documenting redlining and a number of social and economic outcomes today: high poverty and unemployment, low educational attainment, health scores and credit scores. And now a large body of research on the social determinants of health, which weaves tightly with factors that increase vulnerability to heat and coping with heat. So we know that redlining is related to social outcomes, and also the built environment. Again, I do a lot of my research in Baltimore, and you can see on the top we have about 17,000 vacant homes. It's a tough number to get a hold of. And about 14,000 vacant lots. And what you can see is the redlining map on the right showing vacant homes and vacant lots, the overwhelming preponderance of correspondence between today's vacancy and the grades of neighborhoods in the 30s and 40s. I work for the Forest Service. I do urban and community forestry research, as Margaret mentioned, and trees provide a lot of benefits, especially in urban areas. These ecosystem services are linked to health and well-being. And the one we want to talk about today is cooling on the left. So I wrote a paper researching how the distribution of urban tree canopy today aligns with redlining from 80 years ago. Trees are fundamentally slow-growing organisms. So the tree canopy we see today is related to the policies and practices and management years ago. And so we looked at 37 cities, or close to 3,200 neighborhoods as defined by those who did the redlining, Polk and the FHA. And we looked A to B to C to D for tree canopy today. And for the smaller cities, they were included in our cross-city comparison. And in the larger cities to the left of the dotted line, we were able to look within cities. What we found overall is that the A-graded neighborhoods, the neighborhoods that used to be single-family detached, US-born white households, have about 43% tree canopy today. The formerly D-graded neighborhoods, which were denser, populated with BIPOC communities, immigrant communities, have about half as much tree canopy today. I want you to imagine it's raining and you have 43% of an umbrella. And then imagine that it's raining and you have 22% of an umbrella. It's not only a statistically significant difference, it's a meaningful difference in terms of the ecosystem services provided by trees. Within the larger cities, you can see the rank order of housing grades corresponds neatly to the percent tree canopy covered today, and by extension, the ecosystem services, including cooling, which are provided to those communities. So that was a whirlwind tour of trees and redlining. How does it relate to heat? Well, we know that heat is the #1 weather related fatality last year and for the last 30 consecutive years, and it's probably going to grow worse. And we know that cities are hotter than their rural counterparts, especially in forested ecosystems where urbanization means removing tree canopy and putting hard surfaces that absorb and re-radiate heat later at night. So trees provide cooling in 3 ways. 1, they provide shade to prevent those hard surfaces from getting hot in the first place. 2, they exhale water vapor or evapotranspirate. And 3, they change the aerodynamics. It's really shade and evapotranspiration. The roughness or aerodynamics is a small, understudied and underestimated player, but it's still small nevertheless. Based on some research looking at air temperature in Madison, Wisconsin, we see air temperature is significantly cooler when we reach about a 35 or 40% tree canopy cover, whereas impervious surface warms linearly. And the reason that matters is I just told you that tree canopy in formerly A-graded neighborhoods actually meets or exceeds that threshold when the cooling benefits are greatest. Conversely, those formerly redlined areas are not achieving all the benefits associated with tree canopy because they have less coverage. Subsequent research in DC has shown that the relationships actually change throughout the time of day. That pertains, of course, to the moving sun and shading and other factors. But the relationships between tree canopy, impervious surface, and air temperature are really sort of a frontier of research and understanding the urban heat island. A lot of attention has gone to look at redlining and tree canopy. This is a different research group that used a different sensor that showed basically the same thing, that formerly A-graded neighborhoods have about twice as much tree canopy as their D-graded counterparts. So when we link the tree canopy maps to the redlining maps, it's no surprise that the formerly A-graded neighborhoods are cooler than the formerly D-graded neighborhoods, in part because of that tree canopy. So the legacy of redlining and other race-based policies affects the distribution of tree canopy. The distribution of tree canopy, in turn, affects the distribution of heat island, which is, of course, associated with different vulnerable populations. So thanks for the opportunity to present this research. I've learned a lot in these sessions. So thanks for your attention.
All right, and thank you, Dr. Locke, so much for your presentation. So at this point, we'll have about 11 minutes for Q&A. If the panelists want to come on camera. And I haven't seen any new questions pop up in the chat pod yet, but I did see a question from a previous session about the urban or the heat dome in Portland a couple summers ago that talks about something that might relate to Dr. Monteblanco's research. I'm trying to find it.
Was it Nadia's question?
Yeah.
Yeah, so I tried to type it real fast in the chat, or in the chat piece of the Q&A. So I'm kind of new to Portland. I just moved here like 9 months ago to start this new position. So I'm still learning about the resources and capacity and strengths that exist here. But one thing that she made me think about in terms of what lessons we can learn from other cities and who's doing things really well, the Birthmark Doula Collective in the South, they responded to a hurricane in one way. They responded in a lot of different ways, but one of the pieces was to create 24-hour hotline to answer questions from parents and to share resources, right? One of the reasons why I bring up doulas so often is because they understand their community. They are very knowledgeable about what resources exist, what strengths exist, and make bridges and connections across their city and counties. And so hopefully that begins to answer that super important question.
Thank you so much. And just for some context, if you haven't read that question, the question was asking if there's been any learnings from New York or Portland regarding how to respond to the needs of infant, young children, or pregnant and lactating people in the context of heat emergencies. And I see that Dexter is chatting or typing this into the chat as we speak, but I wondered if you wanted to speak to it as well for the whole audience. Are there any other significant factors that contribute to, oops, it went to the answer. Let me read it. Are there any other significant factors that contribute to the temperature of a community outside of tree canopy?
Yes, absolutely. And a lot of the research is focused on urban form. So density, the height of buildings, the shade provided by buildings at different times of day, a lot in hotter climates, different types of shading, different reflective surfaces like reflective pavements and cool roofs and green roofs. And they tend to use really coarse measurements of urban vegetation and tree canopy. What the research I'm working on with my colleagues is to really focus in on the unique contributions of tree canopy and impervious surface throughout the day at different times of day, and particularly as it pertains to air temperature, which is a more pertinent measurement for human health and stress. A lot of the research is using surface temperature, which is important for longitudinal trends and regional types of analysis where we compare cities to suburbs and their hinterlands. But air temperature, I think, is a more salient measure for human health and well-being. And also a lot of that surface temperature uses a satellite that comes over North America at about 10 in the morning. So we're only looking at when it's cooler and long before that incoming solar radiation from the sun has made those surfaces hot. In contrast to that approach, we're riding bikes around cities with air temperature sensors to get more of the lived experience and at a greater range of times to isolate the unique contribution of tree canopy.
Awesome. Thanks for that, Dr. Locke. And Dr. Monteblanco, I'll jump to a question for you. Are there studies that provide numbers as to any increase in maternal or fetal mortality during extreme heat events?
Yeah, thanks for that question. So it's a good reminder that I'm a sociologist and have my limitations with the literature. My focus here was thinking about other adverse birth health outcomes rather than mortality. One of the pieces that's important to this story is that there's a lot of touch points with pregnant people during their pregnancy. So there's a lot of opportunities for intervention and a lot of opportunities to connect with that with the pregnant person. And so I don't know that there's concern with mortality in the same way that we're concerned with that for older populations, for example. But certainly, as I mentioned before, there's concern with something like stillbirth based on a pregnant person being exposed to high temperatures during the pregnancy. Yeah, but of course, like contributing to things like gestational diabetes, like that's going to increase risk for poor outcomes for the mom and the baby.
Awesome. Thank you so much. And Dr. Locke, I'll ask you a couple questions, one that has a shorter answer and one that might have a longer answer. So do you know of anyone doing similar to research to yours in Chicago?
I'm not aware at this time. It could be happening, but I don't know.
All right. And there's another question that might be a little more involved. Do you have any thoughts on green gentrification? And is there any research on this?
Yeah, it's a really hot topic. Green gentrification absolutely exists. It is particularly thorny because it's hard to measure. There are a number of great indices attempting to measure it. But it has this question of, like, let's say like bike paths. Do people move to a neighborhood because they like bike paths, or they move to a neighborhood for a suite of conditions and then advocate for bike paths once they get there. There's a little bit of a which way are the causal arrows going? So it's really tough to measure and in a quantitative framework. A lot of qualitative research has looked at green gentrification, and it's a real research frontier right now, and it's a completely legitimate concern as the amenities pour into neighborhoods that have been denied those amenities for so long. It changes the housing market, and that can have adverse outcomes for those who've been living there. And it's so all amenities can do that, and particularly parks, open space, the quality of parks, street trees, and things like that are certainly part of that package of amenities that make our neighborhoods desirable and in turn change the housing market and have adverse impacts.
Awesome, thank you. Now I'm going to ask a question for Dr. Monteblanco that's coming from some other people who helped organize this event. Can you address any connection with the global efforts underway to address maternal and child health risks from heat?
So attention with the, I'm sorry, I'm struggling to keep track of all the pieces. So a global lens, I think that's an important limitation of my current work, but there demands more opportunities, whether it's through NIHHIS or other organizations, to share information. Just as one example, I'm working with the virtual International Day of the Midwife, right? And there's opportunities across numerous languages, across numerous time zones to share information, including on the climate crisis and response from midwives. So I welcome any and all opportunities to have more of a global lens. I thank NIHHIS for doing some of their urban heat island mapping across the globe. And so there is plenty of room for improvement.
Thanks so much. And we have about 3 more minutes left. We definitely won't get to every question that's asked, but we might get to 1 or 2 more. So here's a question for Dr. Locke. Could you talk about the efforts to estimate the value of ecosystem services provided by trees, especially relating to heat, but also in relation to air quality, noise, biodiversity, water management, recreation, etc.?
Great question, thanks. The Forest Service has a suite of tools called iTree that helps estimate ecosystem services. And it's based on research that links all those benefits listed and more are proportional to leaf area index. So more leaves on larger trees produce more cooling, intercept more stormwater, provide more evapotranspiration, and so on. So there's a suite of tools called iTree, created by the Forest Service and Davy Resources Group, and that's where you want to look for that.
Thanks. And if you could drop the link in the chat, that would be great. Adele, there was a question about materials on environmental and maternal health that you can share, and it seems that Adele did drop something in the chat. So I think the last question I'll have is for Dexter, if you're not busy dropping that link in the chat. Somebody has asked how much tree canopy is ideal for contributing to cooling, over 43% or under, and is there a point of diminishing returns? So that's a lot of questions. So let's just start with.
Yeah, so the research for Madison, Wisconsin shows you're really getting a lot of benefits when you get over that 35-40% in Madison, Wisconsin. In DC, there was less of a thresholding effect, and some research I'm wrapping up in New Haven shows a different tipping point. But those tipping points change throughout the day. And but what is clear is that more tree canopy provides more cooling. But as you get to even greater fractions of tree canopy cover, you're really getting more of those benefits, increasingly so. So that's kind of a frontier. I hope that there's more research and more climates. I hope there's activity in Chicago. And I know that I'm going to be working with more teams to collect more data to look at air temperature and tree canopy to answer that question on a tipping point or threshold.
All right, thank you so much. Thanks everyone for the wonderful questions. Thank you to Dr. Monteblanco, Dr. Locke, and Stephen Samra. There are questions that appeared in the chat that we aren't able to answer in this time. Just real quick, panelists, would you be willing to drop your emails in the chat in case people have questions?
Yes, and thanks to everyone who's organized and all the previous presentations. These events don't just happen. A lot of hard work goes into it. I'm grateful for all that organization.
All right, thank you so much. And I'm going to turn things over to Paul.
All right, thank you, Margaret, and thanks again to all the speakers in that session, and especially to Margaret for moderating. And thank you to all the attendees for your great questions, and as well as your patience with the technical difficulties. It's really interesting to hear about the work that's being done on kind of the complex intersection between disproportionately impacted populations, policy, and the built environment. So we're now going to take our first break of the day. We hope that you'll all be able to join us again. We will start back at 2:35 Eastern, and the next session will be on the next group of disproportionately impacted populations, workers. So we'll see you all back here in a little less than 20 minutes at 2:35 Eastern. Thank you.
Yes. Go get a break. Come back.
Hi, everyone. We're just about done with the break. We'll get started in a little less than 2 minutes. Thanks. Right, everyone. It is 2:35 Eastern, so we'll get started with the next session. Welcome back. We're excited to welcome our next group of presenters to discuss another group of disproportionately impacted populations, workers. To open this session, we're honored to have opening remarks from OSHA leadership. James Frederick, the Deputy Assistant Secretary of Labor for Occupational Safety and Health. James Frederick has 3 decades of experience providing occupational health and safety leadership to North American labor unions as an advocate and a resource to workers, their employers, and regulatory agencies. Mr. Frederick spent 25 years in the Health, Safety, Environment Department of the United Steelworkers Union, serving as Assistant Director and Principal Investigator until 2019. In that role, he provided technical guidance to the USW and other unions on matters pertaining to occupational health, safety, and the environment. Mr. Frederick worked closely with USW's management counterparts and organizations around the world on a wide range of projects to improve workplace health and safety. Welcome, Mr. Frederick.
Thank you. Thank you for that introduction. And also thank you for inviting OSHA and me specifically to be here today. And also for your interest in heat and your work in making workplaces and communities safer. We all know the physical impact of both outdoor and indoor environmental heat. The Bureau of Labor Statistics reported that environmental heat cases led to approximately 38 fatalities on average each year from 2011 to 2019. And at OSHA, we certainly also understand that these numbers are probably low because of underreporting. For example, a heart attack is often listed as the cause of death when the actual cause might have been exposure to a heat-related hazard. In addition to these largely preventable deaths, there were also about 3,500 cases of heat illnesses and injury with days away from work each of those years. We at OSHA also note the social impact of heat hazards. Workers of color are disproportionately make up the population of workers who are in jobs exposed to high levels of heat. So they suffer heat illnesses, injuries, and death disproportionately. That makes the work that we are doing on heat both important and urgent. As we work towards at OSHA, as we work towards longer term solutions using our rulemaking tools, we're also enhancing our efforts to make sure that employers and workers understand the dangers of heat illnesses and how to prevent it. In September of 2021, we initiated a nationwide enforcement initiative on heat-related hazards. This initiative expanded on OSHA's ongoing heat illness prevention campaign and prioritized heat-related interventions when the heat index exceeded 80 degrees Fahrenheit and other risk factors were present. At this time last year, we implemented the Heat National Emphasis Program. Our National Emphasis Program has allowed OSHA inspectors to inspect jobs and industries with high levels of heat hazards before workers are exposed. So since that program started, OSHA has conducted more than 1,700 heat-related inspections in workplaces. OSHA has also established a heat injury and illness prevention work group of our National Advisory Committee on Occupational Safety and Health, often referred to as NIHHIS. This work group has evaluated and recommended improvements to OSHA's heat illness and prevention guidance materials and is currently developing recommendations on potential elements of a proposed heat injury and illness prevention standard. And I believe the next meeting of that group is in just a couple of days, so we're looking forward to hearing back from them. Also, in October of 2021, OSHA published an advance notice of proposed rulemaking for heat injury and illness prevention in outdoor and indoor work settings. OSHA received 965 unique comments, which the agency is currently analyzing and assessing. We know that extreme heat is a long-term problem, and we recognize the urgency to address its immediate impacts. The next step in the rulemaking process for OSHA will be to convene a small business advocacy review. This is a requirement of the Small Business Regulatory Enforcement Fairness Act, often referred to as SBREFA. And this allows us to hear comments from small entity representatives on the impacts of any heat-specific standards to their businesses. So we should all be looking forward to that in the relatively near future. All of these efforts at OSHA are also part of the Biden-Harris administration interagency effort and commitment to workplace safety, climate resilience, and environmental justice. OSHA is deeply engaged with the Biden administration's interagency working group on extreme heat. We're also one of 8 federal agencies involved in the National Integrated Heat Health Information System Partnership, dedicated to leveraging the best available science to eliminate health risks of extreme heat. We also certainly recognize that employers have an obligation to provide a safe and healthful workplace. We recognize employers who are successful in addressing heat illnesses, hazards, and engage their workers, by listening to their ideas and implement a plan that provides multiple layers of controls to mitigate heat stress related hazards. Our vision at OSHA is to see safety and health established as a core value in every workplace in America. Every worker across the country deserves equal access to a safe and healthful work environment. That includes workplaces that have heat hazards, and we will continue to use all of our tools in our toolbox to ensure that all workers have the safe and healthy protections that they need and deserve. One last item that I'd like to draw your attention to before I close out is that we just recently, in the last few days, have announced an OSHA Beat the Heat national contest. And if you go to the OSHA website, osha.gov, or just search for OSHA Heat National Contest, you'll certainly get yourself your browser to that URL and find the information about it. And between now and June 9th, we'll be taking applications from various parties of items that they've done, controls that have been put in place, and efforts that are being made to address heat hazards in workplaces. And after June 9th, we'll circle back with and through that process and review, and we'll recognize a number of folks that are doing good work in the heat space. So I just want to close by thanking all of you for your support and helping us at OSHA reach that goal. And I'll turn it back over. Thank you so much.
Thank you, Mr. Frederick, for those wonderful words. We're going to begin our session with Juanita Constable. Juanita is the Senior Climate and Health Advocate at the Natural Resources Defense Council. In her current role, Juanita helps advance climate adaptation solutions to the threats of extreme heat and other climate-related health hazards. Her efforts are particularly focused on protecting worker health and safety from heat and integrating equitable heat preparedness into federal and state policies and programs. Prior to joining the NRDC, Juanita oversaw the Science and Solutions Department at the Climate Reality Project and later served as an advisor to the Climate Action Campaign. She currently serves on an ad hoc committee convened by the National Academy of Sciences, Engineering, and Medicine to plan a workshop called Communities Change and Health Equity, Lessons Learned in Addressing Inequities in Heat-Related Climate Change Impacts. Juanita holds a bachelor's degree and a master's degree in biology from the University of Victoria in Canada. Welcome, Juanita.
Thank you so much, Lynn, and happy Tuesday, everyone. I always know summer is coming when I have a sudden explosion of heat and health-related messages and meetings in my inbox and calendar. But this meeting, NIHHIS National, is the hottest one of all, so I'm really honored to be here today to talk to you about the critical issue of worker health and safety. Next slide, please. As we're waiting for that, perfect, thank you. So you've already heard today that some populations of workers are highly vulnerable to heat-related illnesses, injuries, and deaths. But why is that, given that heat can affect anyone and that heat can occur just about anywhere? Well, as with any vulnerable population, there isn't just one factor that puts workers at higher risk. Rather, it's a unique combination that I'm going to summarize at a very high level today as exposure, effort, and economic necessity. Next slide, please. The 3 E's of exposure, effort, and economic necessity are important to remember when you encounter statements like the ones on this slide. So these are all real life examples of things some industry groups have said to the Federal Occupational Safety and Health Administration to argue that heat safety standards are neither necessary nor feasible. For instance, some employers argue that heat is not unique to workplaces, which is true, of course, but neither are power tools and ladders, and yet we have federal safety standards to cover both of those hazards. Another argument is that workers are doing something wrong. This is the time-honored blame the worker argument used to shift responsibility away from employers, who, by the way, are legally required in most industries to keep their workers safe. The next one, that employees will find another job if an employer doesn't provide adequate heat protection, is again partially true. I've certainly seen media reports of folks leaving hot kitchens for other jobs. But we know that many workers do not have other options available to them, perhaps because of family obligations or their skill sets, or because they have a temporary work permit for a very specific job with a very specific employer. Now, my favorite argument on this slide, because it's so weird, is the last one, that access to air conditioning and other amenities of the modern employee lifestyle are the reason workers get sick from heat on the job. Oh, this is a red herring for most workers, and as we'll get to in a minute, not even close to true for some migrant farm worker populations. Next slide, please. So let's look at the first of the 3 E's, exposure. Many jobs require long hours of unavoidable exposure to high temperatures. You may think of outdoor workers, but it's not just them. There's also workers that have to be near hot equipment, such as ovens, or workers in indoor facilities that don't have enough cooling or ventilation, such as in some warehouses. That heat exposure is intensified when workers have to wear specific uniforms or personal protective equipment that track heat. Even when I'm walking around Washington, D.C. in the middle of the summer and I see a hotel doorman with a black polyester uniform, I feel like I'm melting. Next slide, please. Some worker populations are also exposed to heat in employer-provided housing. So these are photos from a research project on farm worker housing camps in North Carolina. The researchers found that most of the rooms across 170 different camps had unhealthy heat index values. Now, although these photos were taken in 2010, the situation in the state hasn't really changed much. In 2020, less than half of farm worker housing in North Carolina had air conditioning. When workers can't cool down during their rest hours, they are a lot less likely to show up to work the next day hydrated and ready to be their healthiest and most productive selves. Next slide, please. The next big E is for effort. So our bodies are always generating heat as a byproduct of the cellular processes that keep us alive and ticking. The more active we are, the more metabolic heat we produce. That metabolic heat of a really active worker combines with environmental heat exposure and the clothing that they're wearing to produce a total heat stress on that worker. Next slide, please. And then there's economic necessity. As we saw repeatedly during the early years of the COVID pandemic, so-called essential workers are often forced to choose between their paycheck and their health. And a similar dynamic can occur with heat. So for example, some warehouse and distribution center employers have been in the hot seat recently with lawmakers for imposing penalties on workers who do not meet a strict production quota. Penalties like that can make it harder for workers to take the protective cool down and water breaks they need to stay safe in the heat. And then workers who get paid by the unit of production, otherwise known as piecework, they also may be reluctant to take breaks. We see examples of this in farm work and the gig economy. Furthermore, about 20% of civilian workers in America do not have paid sick time. And among workers in the bottom 25% of wage earners, who are the ones that are probably most likely to be exposed to a lot of heat at work, nearly half of them do not have paid sick time. Those lower wage workers may opt to push through the kinds of mild heat symptoms that have the potential to escalate into medical emergencies. Next slide, please. Another economic driver that keeps workers in dangerously hot conditions is retaliation by their employers. Retaliation is illegal in the US, but it happens all the time, unfortunately, particularly in industries that rely heavily on immigrant labor and other vulnerable populations. For instance, farm workers who complain about unsafe work practices may find themselves blacklisted across the ag industry, or they may be threatened with deportation if they have temporary work visas or are undocumented. And then, of course, there's always the threat of being fired. Next slide, please. In addition to dealing with a unique combination of heat-related threats, workers may also be experiencing a unique combination of heat-related harms. For instance, there's a growing body of evidence to suggest that heat exposure may increase the likelihood of traumatic injuries such as fractures or amputations. Now, Dr. Spector, who's speaking after me, is one of the leading experts on this topic, so I'm going to leave that here for now. Another area of intense interest is kidney disease. In recent years, some of the world's highest death rates from chronic kidney disease have been seen in agricultural workers in Central America. Now, heat may not be the only factor at play, but research there and in the US suggests that heavy exertion combined with recurrent heat exposure and dehydration may be a big problem for the kidneys of workers across a variety of industries. Finally, there's an intriguing study that suggests heat exposure may increase workplace harassment and discrimination. Stressors like those, of course, can also affect the mental and physical health of workers, not to mention their productivity. Next slide, please. So I've been delivering nothing but bad news for the last few minutes, but as you'll hear from our next speakers, there is good news. With the right planning and combinations of hazard control, most heat-related harms can be prevented in the workplace, as long as the threat is recognized in the first place. Thank you so much.
Thank you, Juanita. Great presentation. Next up, we have Dr. June Spector. Dr. Spector is a physician researcher at the Washington State Safety and Health Assessment and Research for Prevention SHARP program and an associate professor at the University of Washington. Her work focuses on the prevention and management of adverse health effects of occupational heat stress. She is a member of the ACGIH Physical Agents Committee, where she contributes to the Heat Stress Working Group. And she serves as a technical public health expert on the Heat Injury and Illness Prevention Work Group of the National Advisory Committee on Occupational Safety and Health. Welcome, Dr. Spector.
Thank you so much, Lynn. It is great to be here discussing these important issues with all of you. I'll be talking today about prevention and management considerations for occupational heat stress. Next slide. So this won't be comprehensive, but I will aim to share a high-level overview of approaches and opportunities, and I'll use the following symbols throughout the presentation to highlight just a few examples of the research and evidence base behind selected approaches, practical solutions and tips, and also some gaps for which there are opportunities for future work. Next slide. To frame this discussion, CDC has a great social ecological model of prevention shown here that has been applied in multiple contexts. The idea is that it is necessary to act across multiple levels to achieve sustained prevention over time. Adapting this to the occupational heat stress context, I'll review prevention approaches that range from federal and state policies to workplace best practices that address employer, interpersonal, and individual worker factors, and potential tie-ins with general public health efforts in the community that I think will be discussed later in this conference. Next slide. We'll start with federal and state standards, which are enforceable and ideally clearly indicate roles and responsibilities for employers and also workers. In addition to the federal heat rulemaking process that we heard about in the introduction to this session, which is underway, I've shown a couple of examples of states that have instituted heat protections for workers, with several others in development that aren't shown on the slide, and we'll hear more about Oregon in particular in the next presentation. While the development of standards includes feasibility and economic considerations, guidelines, in contrast, are not enforceable and are usually mostly health-based, and so guidelines may be more health protective. So there's this distinction between the standards and guidelines. And a couple of examples of guidelines shown on the slide for heat include the National Institute for Occupational Safety and Health, or NIHHIS, criteria document that was mentioned earlier for heat, as well as the American Conference of Governmental Industrial Hygienists, ACGIH heat stress threshold limit value, and there are others. So this brings us to our first set of opportunities, one of which is to participate in the policymaking efforts through public comment processes. In addition, a policy relevant opportunity for researchers is to address gaps that there are in research on real world evaluations of the benefits of different prevention measures on occupational health outcomes, which we learned in the last presentation include heat-related illness, heat-related traumatic injuries, kidney injuries, and other outcomes. And we do need additional studies in more diverse working populations. In the next section on workplace approaches, I'll focus on general best practices and not standards. Standards currently vary from state to state since the federal rule is not yet in place. Next slide. Workplace risk assessments should inform heat stress management plans and should include assessment of modifiable factors that comprise net heat stress. So not only the environmental heat exposure, but also considerations of workload and clothing and personal protective equipment, or PPE. Acclimatization is another modifiable factor. It is a physiological adaptation to heat that can take up to 14 days of work in the heat to develop and can be lost after about a week away from working in the heat. Groups of workers who are less likely to be acclimatized include those who are new to the job, returning from a prolonged absence, and exposed to sudden increases in heat stress, such as during a heat wave. Risk assessment approaches, such as in the previously mentioned guidelines, provide guidance for how to factor in workload clothing and acclimatization status, in addition to environmental heat exposure, into the risk assessment. Next slide. I believe there's an upcoming presentation tomorrow that will cover different heat metrics, so I won't go into that. I'll just mention a few items to consider in the occupational context for environmental monitoring. First, ideally, decisions about heat exposure metrics should consider worker health relevant elements, which include temperature, humidity, radiant heat, air movement. And the gold standard in occupational health is considered for NIHHIS to be the wet bulb globe temperature, or WBGT, which is a composite metric that accounts for all of these factors. However, measuring WBGT may not be feasible in all workplaces and settings, and there are alternatives, each with their own strengths and limitations. In addition, the form of the exposure should be considered. For example, NIHHIS and ACGIH recommend a time-weighted average approach if conditions vary, and there should be consideration about what conditions warrant action, which is described in guidelines. Data source considerations include which sources of heat information are feasible to use, local enough to accurately assess exposure, are trusted by end users and likely to promote preventive behaviors, and also allow for forecasting for employer and worker work planning. A practical tip for workers and supervisors is to check the forecast in advance to be prepared of the workday and guide preparations. In general, guidelines typically recommend increasing levels of controls, for example, from general to job specific, with increasing levels of heat stress identified in the risk assessment. Next slide. A commonly used workplace prevention approach is the industrial hygiene hierarchy of controls, which characterize hazard controls, in this case, heat stress controls, on a continuum of strongest, so getting rid of the hazard altogether, to weakest, for example, PPE use, which relies on individual behavior. Here, elimination could be future-oriented, for example, in thinking about the design of future indoor work facilities in terms of optimizing HVAC systems, the location, the roof color, et cetera, or even climate change mitigation. However, we are in the now, and we need to also address heat stress as it currently exists in current workplaces. The measures in the industrial hygiene hierarchy of controls might not be perfectly effective, though, so identification and management of early health effects is also needed to prevent more severe health outcomes, such as death from heat stroke. A heat stress management program, or HSMP, addresses both of these forms of prevention, or prevention and management, by setting workplace practices and policies. Extrapolating from ergonomics research, where participatory ergonomics has been shown to improve worker musculoskeletal health outcomes, involving workers in planning may increase the chance of effective and sustained management of the hazard, and so that is a best practice to involve workers in planning. Next slide. An HSMP includes a written heat stress management plan that outlines the different aspects of the program and is accessible to all workers. It may be helpful to provide employers with an HSMP template that can be adapted to the specific circumstances of each workplace, and the plan should be periodically reevaluated. Education best practices include providing verbal and written education in a language and format that is understood by workers and supervisors for new workers, and at minimum annually. There is published research on heat stress education that has evaluated approaches in agricultural settings using comparison designs, reporting characteristics of effective education as listed on the slide. Heat stress hygiene practices include hydration, rest breaks to reduce metabolic or internally generated heat, appropriate shade to reduce radiant heat, for example, from the sun, taking care that controls are not provided in a way that generates new hazards or disincentivizes their use. Next slide. So heat-related illness education can form a foundation for workers to monitor for and recognize signs and symptoms of heat-related illness in themselves and others, to know how to respond and to understand their personal risk factors. There are acclimatization schedules, such as those recommended by NIHHIS, for gradual increases in workplace exposure to heat stress, and can increase heat tolerance by about 2.5 to 3 degrees Celsius WBGT. A buddy system can be a practical approach to help address some of these elements and ensure workers are not working alone in the heat. There are opportunities for additional research on the effectiveness of different acclimatization approaches in different groups of workers and settings to be able to refine and tailor acclimatization best practices recommendations. Emergency response procedures are critical, and having periodic drills may help for preparedness. For heat stroke, it is recommended to initiate cooling in the field. The reason that appropriate emergency response is so important is that research has demonstrated that timely cooling of an individual with heat stroke increases the chance of survival. Next slide. As heat stress increases, guidelines recommend additional controls. This includes engineering controls that reduce metabolic heat generation, provide general air movement, dehumidify, shield radiant heat sources, and adjust clothing requirements. Administrative controls set acceptable exposure times, allow sufficient recovery, and limit physiological heat strain, and can be accomplished through breaks, reductions in work pace and intensity, rotation of tasks in and out of cooler conditions, and or scheduling heavier work during cooler parts of the day, and enhanced communication and observation. And removal of non-breathable PPE and layers should be performed as recommended in guidelines when possible, and light breathable clothing worn. There isn't time to talk about personal cooling and physiological monitoring, which are important topics that have their own caveats and strengths. So we'll move on to the last slide. And I'll conclude by raising a few items for thinking beyond the workplace to how we can further prevent occupational heat stress through tie-ins and partnerships with general population prevention efforts with the total worker health and a systems lens. For example, we can think about understanding effects of hot housing conditions, as was mentioned in the last presentation, on occupational heat health outcomes, which relates to cumulative exposure that workers face and potential decrements in sleep quality and quantity in the heat that may also affect occupational injury risk. Second, it would be helpful to coordinate on integrating occupational health into heat action plans that many jurisdictions are developing. And finally, as we've heard in prior presentations, we can better support healthcare provider education As an example, to improve recognition and recording of occupational heat health outcomes, for example, through documenting appropriate diagnosis codes and other relevant occupation information to help us improve our surveillance, which informs prevention efforts. And I'll go ahead and stop there. On the next slide is my contact information, which I will also put into the chat. I'm happy to take questions as time allows. Thanks. Turning it back to Lynn.
Thank you, Dr. Spector. Great presentation. And our last presentation for this session is Theodore Ted Bunch. With a background in biology and toxicology, both environmental and human health perspectives, Mr. Bunch has spent over 25 years of his career dedicated to improving public and environmental health. He is passionate about improving the health of our planet, as well as improving the quality of life for everyone. In his current role, Ted is focused on helping develop protective measures for workers who are exposed to ambient heat, whether the exposure is from a process, such as a kiln or a bakery, or from a combination of outside temperature and humidity, such as outdoor work settings in construction and agriculture. Ted also participates in several industrial groups, including as Oregon's OSHA primary contact to the Pesticide Analytical and Response Center and Oregon's representative to the Association of American Pesticide Control Officials for the Worker Protection Standard. The ultimate goal of Ted's work is the prevention of heat-related illness. As he puts it, quote, "I am dedicated to exploring ways to accomplish this through action and education," end quote. Welcome, Mr. Bunch.
Well, thank you, Lynn, for that kind introduction. Just to follow up on Dr. Spector's presentation, you will see a lot of the recommendations we actually put into our rules. On March 10th, 2020, then Governor Kate Brown issued Executive Order 20-04. This executive order directed certain state agencies to reduce greenhouse gas emissions and mitigate the impacts of climate change. The executive order included a directive to the Oregon Health Authority and Oregon OSHA to jointly develop a proposal for standards to protect employees from workplace exposures to both excessive heat and wildfire smoke. In response to the executive order, Oregon OSHA, in collaboration with the Oregon Health Authority, a rulemaking advisory committee, and stakeholders, developed rules to protect employees from the serious risk of work-related heat illnesses. At this point, I was going to mention the heat dome that Oregon experienced in June of 2021, but Mr. Haggerty did a great job earlier in that regard. Next slide. I'm going to quickly go over our heat illness prevention rules. Just to inform, these rules also apply to agriculture, labor, housing. In terms of the scope of our rules, it applies to both indoor and outdoor workplaces whenever the heat index, which is a combination of the temperature and relative humidity, is equal to or exceeds 80 degrees Fahrenheit. Our rules contain both full and partial exemptions. In terms of the full exemptions, it relates to incidental heat exposures when employees are exposed to excessive heat for 15 minutes or less in a 1 hour period. Heat generated from a process such as kilns, foundries, bakeries, emergency operations when they're actually engaged in an emergency are fully exempt, and buildings with a mechanical ventilation system that keeps the heat index below 80 degrees Fahrenheit are also fully exempt. In terms of the partial exemptions, those employees that are performing rest or light workloads are partially exempt from our rules only when the heat index is less than 90 degrees Fahrenheit. Associated support activities for wildland firefighters are exempt from the acclimatization part of the rule, and those employees working from home are only subject to the training requirements. Next slide. To continue, our rules state and require that water and shade must be provided. Water must be provided, 32 ounces of water per employee per hour when the heat index is equal to or exceeds 80 degrees Fahrenheit. Our rules define shade as the complete blockage of sun. And when shade is provided, it must be large enough to accommodate all of those employees on their heat illness prevention rest breaks. Our rules require an emergency medical plan so that employers can respond to heat-related emergencies. Our rules also require a heat illness prevention plan. There are 7 elements in that plan. In terms of acclimatization, our rules require that employers either follow NIHHIS acclimatization schedule or develop their own acclimatization plan based upon 5 different factors, such as an employee's acclimatization status, work clothing, things along those lines. We do have a training requirement in our rule, both for supervisors and employees. Our rule has a second threshold when the heat index is equal to or exceeds 90 degrees Fahrenheit. Heat illness prevention rest breaks must be provided along with increased communication, establishment of a buddy system if possible, and things along those lines. Next slide. In Oregon, we are required when we go to permanent rulemaking to engage stakeholders, and we engage stakeholders through our rules advisory committees. You can see that we began our rules advisory committee meetings in March of 2021, and we had 5. And as was alluded to earlier, in late June of 2021, we experienced a occupational heat-related fatality in the state, and the governor directed us to go to temporary rulemaking. That temporary rule became effective on July 8th, 2021, approximately 12 days after we received the directive from the governor. Next slide. So after we issued the temporary rule, we pivoted back to our permanent rulemaking. We conducted 3 more Rules Advisory Committee meetings. Our permanent rule became effective June 15th, 2022. Following the adoption of the rule, that's when the real work begins. Oregon OSHA created or updated 15 different unique resources to assist employers in complying with the rules. And most, if not all of these resources are also available in Spanish. Because of the training requirements of our rule, we created an online training program. That training program satisfies 5 out of the 7 training elements that are required in the rule. 2 of those elements are employer specific. Next slide. So in terms of some of the lessons learned, some employers believe that the full exemption applies even when the mechanical ventilation system is not functioning, despite the fact that the rule explicitly states that the mechanical ventilation system needs to keep the heat index below 80 degrees Fahrenheit. Some employers believe that the heat illness prevention rules do not apply if there is a heat source generated from a process. Oregon OSHA is in the process of developing a fact sheet to address this. Some employers find it difficult to institute acclimatization plans. They find it difficult to follow NIHHIS' recommended schedule. However, employers do have the option of developing their own acclimatization plan. Indoor swimming pools present a unique situation due to the volume of water, the volume of the heated water, which increases not only the relative humidity, but also the temperature inside swimming pools. In terms of employees working from home, I mentioned that they are only subject to the training requirements. We certainly believe that employees working from home should be able to recognize the signs and symptoms of heat-related illness, whether in themselves or in others. Employers also would like additional examples of rest and light work An example of rest work would be sitting or thinking, light work. An example would be something like sewing. Last slide. I've put on this slide a link to Oregon OSHA's heat stress website, where you can find all of the resources that I mentioned, the online training program, links to our rules, links to the comments and agency decisions document that describes our thought processes in developing the rules. There's my contact information along with my phone number. If there are any questions, feel free to contact me. Thank you.
Thank you, Mr. Bunch. Great information. So I did want to remind everybody that the slides will be shared with those individuals registered. We do not have time for Q&A, but please post your questions in the Q&A function in the chat. And thank you to all of our presenters, and I'm going to hand it over to Julie.
Thank you, Lynn, so much for facilitating that amazing session. And actually, thank you to all of the presenters. You raised so many issues, which is kind of the point, like, where are we and what do we need to do? So that was really a very helpful session. And the whole afternoon's been really great. So thank you to not the last session, but the entire everybody session. However, we have a moment now where we're going to pivot a little bit, and we are really pleased to have Kristen Averett, Dr. Kristen Averett, who is the person at the White House, our Council on Environmental Quality to be exact, who is leading and cheerleading on behalf of heat. She's officially a drought and Western resilience coordinator, comes to us from Las Vegas, from the West, but has had a long history with NOAA. She was in the governor's office in Nevada. She was and still is a professor at University of Colorado and several other institutions. So Kristen brings to us a wealth of knowledge and perspective. And we are so thrilled to have her at the White House leading and advocating for the heat work. And Kristen's going to host a panel that will help us understand what the federal government is doing and offering and has to contribute. And so just one last thing before I turn it over to Kristen. Most of the discussions today are setting the stage and addressing populations that we are either serving or know we need to do better. But I do want to say that we, as NIHHIS, are really looking forward to the dialogue. We have a networking session later. We've got next couple of days, but really look at this as a starting point and an entry point. So Kristen, you're going to give the federal perspective, but I want folks to leave from that thinking your government's working for you. We want to figure out how to be more helpful even than we are. And we are really grateful that you have a very on the ground perspective as somebody in the White House. So you have a very unique stance here. And we're really grateful to you for being here and for running the session. So over to you, Kristen.
Thanks, Julie. And thanks to once again to everybody for all of the work that you're doing in this space. It really is incredibly impressive. And we've come a long way in the last year. I should say y'all have come a long way in the last year. So today, it's been really encouraging to hear that there hasn't just been the characterization of the problem of extreme heat, but such a focus on the solution space. And so building off that platform, we really want to talk a little bit about what the federal enterprise is doing to address this particular hazard. And as I mentioned in my opening remarks a couple hours ago, the Bipartisan Infrastructure Law and the Inflation Reduction Act offer unprecedented opportunities to invest in programs, projects, and people so we can respond, prepare, and build resilience to extreme temperatures. So in the spirit of the Biden-Harris administration's whole of government interagency approach to addressing climate change issues, today we're going to hear from representatives from across the federal enterprise about what they are working on and how they're working together to deploy resources to ensure communities are protected from the impacts of extreme heat. So I very briefly want to run through everybody. I'm going to ask the folks on the panel to wave when I mention your name. So first, from NOAA, we have Dr. Shali Malaji, who is the Senior Advisor to the NOAA Administrator. Then we have Dr. John Baldus, who's the Acting Director of the Health and Human Services Office of Climate Change and Health Equity. We have the USDA Forest Service, Dr. Quinn Hollifield, who is National Program Manager for Urban and Community Forestry Program. From FEMA, we have Paul Faricelli, who is the FEMA Senior Climate Advisor. And from the VA, Dr. Tom Osborne, Director of the National Center for Collaborative Healthcare Innovation with the Veterans Administration. And then last but certainly not least, from Housing and Urban Development, we have Alexis Pelosi, the Senior Advisor for Climate in the Office of the Secretary. So with that, I'd like to kick it off by asking a couple of our panelists a question. All right, and I see everybody's bright, shiny faces. Thank you again for joining us and taking the time. So I am going to start with you, Dr. Osborne. Climate change has touch points all across the federal government in ways that might not always be so straightforward to people. And some might think, okay, what role does Veterans Affairs actually have in addressing extreme heat? So I wondered if you could share more about your work in this space and what the VA is doing.
Yeah, fantastic question. I appreciate that. I think there's quite a few reasons why VA has a significant role. And quite frankly, I would add that we all have both the responsibility and with that an opportunity in this collaborative effort to address health in extreme heat. So from my lens, there's quite a few reasons why this topic is important for VA. And, I don't think we can go through it all, but in the interest of time, maybe I'll touch on three things briefly. The first thing is VA's primary mission is to provide the best care possible for our veterans. And obviously there's a lot that goes into that. And a big part has to be about being proactive and about understanding and addressing emerging risks. And as we've discussed in this meeting, and everybody knows, that climate change and climate-related health risks is one of the most important health concerns of our time. So second one, moving quickly, is VA cares for a large number of older adults who have oftentimes multiple comorbidities. And for many people, the VA also acts as a safety net, providing care that may not otherwise be accessible for those who are sometimes socioeconomically disadvantaged. And this context, I think, is particularly relevant because, as we know, these groups are at increased risk for heat-related illness and mortality. And then the last thing that's top of my mind is that the largest integrated healthcare system in the US happens to be the VA. And we're providing a full spectrum of care for millions of patients from across the country. And with that, therefore, the challenges that we collaborate to uncover, partially with our extensive data, and the problems that we solve have a high likelihood of being relevant for many others across the country and perhaps even the world. So I think that, all together, all of us can do a tremendous amount. Now, we're also collaborating with a lot of great people in this meeting and elsewhere. We've got an MOA with the CDC and HHS Office for Climate Change and Health Equity. We've been a part of NIHHIS for quite a long time. We're working with to do additional things with NOAA, which is quite exciting. And we've also recently collaborated with CDC and some cool people on the call like Paul on an extensive 18-year survey of looking at our observational EHR data over 18 years and have come up with a lot of conclusions. It's currently in peer review, but there's a lot of really interesting and important insights coming out of the collaborative work we're doing together.
Collaboration is music to my ears, and I just love hearing what you're working on and the like. So I guess my next question, I'm going to pivot to Dr. Ball. Sorry, there's a little noise in the background. I apologize. And I wondered, so from the Health and Human Services perspective, I wonder if you can elaborate a little bit more on the work you're doing at HHS with data collection, tool development, and communicating public health risks. And I'm very curious about what the perspective on the president's executive order from Friday around environmental justice and how your office has been already working in that environmental justice space with the nexus of climate change and public health.
Sure. Thanks, Kristen. And really pleasure to be on this panel with these incredible colleagues from across the federal interagency. It's great to see everybody. The data piece of this is really, really important. And I'm just going to focus on that a little bit. And we've heard a little bit already about the collaboration that's gone on under the aegis of NIHHIS, especially between CDC and NOAA, in creating the CDC heat health tracker, a few years ago, and, with the partnership with NOAA to define the heat risk thresholds. And then we've heard a little bit about some of the work that we're doing related to subseasonal, seasonal forecasting. So we've gone from that CDC heat health tracker and a collaboration between our office and the ATSDR to create the Environmental Justice Index and put those things together with the subseasonal forecasts that are feeding the heat health tracker, but also the subseasonal forecast for hurricanes and wildfires and drought. And we've created an integrated data set that includes these subseasonal seasonal forecasts, but also the Environmental Justice Index indicators and more, including some unique forms of health data to show actual health burdens from heat at a fine grain level. And we put that together in the Climate Health Outlook. We're going to hear more in much more detail about the Climate Health Outlook later, but we're also looking to use that data set to make it available on an operational scale and also a public scale, so that people will be able to go in and see seasonal, subseasonal forecasts in the contexts of the vulnerable populations that are most affected. So there's just a lot of similar things going on in a lot of different places. But one of the things that's really important is that there's so much pivot now in the Biden administration to resources going into the communities that need it most through the Inflation Reduction Act, through the bipartisan infrastructure law. And the guidance is going out to, be using right now the CJEST, the Climate Justice Environmental Screening Tool. We're looking to beef that up a little bit, to iterate on the CJEST and make sure that it is bringing in the capabilities of the Environmental Justice Index, which includes cumulative stressors and actual health burdens. And that is one way in which having the Office of Environmental Justice that was created about a year ago by Secretary Becerra be co-housed with the Office of Climate Change and Health Equity. And so the new Environmental Justice Executive Order, which primarily really gives more structure, accountability, and regularity to the environmental justice activities across the agencies, really fits in well with the work that we're doing in the Office of Climate Change and Health Equity to bring the environmental side of the social determinants of health into the mainstream of HHS. So part of it is giving it to the public and informing, states and localities, but we're also working with the Administration for Children and Families to help to guide the Justice 40 program, the Low-Income Household Energy Assistance Program, and identify those neighborhoods that aren't just in heat islands, but also have the highest health burden of heat. And we're doing similar work, across other parts of HHS, looking at ways we might be able to bring these kind of integrated environmental health data sets to, for example, community health centers and electronic health records through some pilots. So I'll stop there, but it's this pivot from assessment and the creating of resources that we just put out to actually applying these kinds of integrated data sets to the decision making and the actions that go on in this administration and also in the clinical setting.
No, and I completely appreciate that, the integration of data, which is so important, because I've heard you point out that it's not just about what the heat and the temperature is outside, it's about what are the health indicators and the multiple layers and comorbidities and metrics that we need to have in place. So I hear you loud and clear on that one. So now let's pivot over to NOAA and to Dr. Malaysia. So NOAA, we've heard you mentioned a couple times here, and of course, Dr. Spinrad opened up the meeting for us. So NOAA has an important role in data collection and education, whether it's actually during a heat emergency, thinking about the response function, or if it's in terms of identifying persistent risks and vulnerabilities, which is really in that resilience sort of mode. So I wondered if you talk a little bit about NOAA's activities in both that response capacity as well as in the resilience space.
Sure, I'd be happy to. But I just wanted to really quickly just thank you, Kristen, for everything. And thank you for your leadership. It's just incredible to have the White House engagement here at NIHHIS focused on heat health. It's just a moment that I actually want to take and acknowledge how successful NIHHIS has become with this level of participation across the entire government. I mean, as always, HHS and my colleagues at NOAA have been doing this for a very long time, and it's so appreciated. But look on the screen, it's so exciting that HUD is here, USDA is here. I know NIHHIS has had a wonderful blooming partnership with the VA, FEMA, and the Department of Transportation. And we're hoping that NIHHIS can grow its partnerships with the Department of Energy, even looking to engage the private sector as well. But I know this is the second year, but it's just such a great victory. I wanted to take a minute, recognize all that NIHHIS has achieved in just this screen and this level of participants. So with that, though, in terms of NOAA, so NOAA is the National Oceanic and Atmospheric Administration. We have an agency with national services, with research labs, with programs across the agency, including the National Weather Service and the Climate Prediction Center. And we work across the entire continuum of hazards. So we're working across all of the phases of hazards, so preparedness, response, recovery. We're also working across all the time scales. So we're trying to figure out how can we best mitigate risk by optimizing timing and user needs. So for example, NOAA provides early warning systems and seasonal outlooks so that we can alert people months in advance of events like a very hot upcoming summer. The key here is that we're providing lead times of months to give people time for planning, to help them understand what their risks are. And I will say that one of Dr. Spinrad, who is the NOAA administrator who you heard from this morning, one of his top priorities is equity. And so having that lead time gives us more time to work with traditionally underserved communities to help them really assess what their risks are and how we can work to mitigate them with a long lead time. But we also have the day of timing event in real time. So the National Weather Service is our operational service within NOAA. They provide forecasts in the time frame of days to alert the public when a heat wave is coming on. And then we've got sort of the long-term, the continuous long-term basis that NOAA works with communities to build that resilience that Kristen's talking about. And so we're working to help inform communities of weather and climate risk. We're helping to inform communities how to build a more resilient built environment. We're working with our federal partners to try to give the data and the information on those risks so that decision-making can consider both the near-term and long-term risk mitigation. And just one last thing that I don't know if everybody knows, that NOAA has offices in every region and in every state by mandate. So we've got local offices everywhere. We've got a place-based footprint designed to help do community outreach and share with everybody the scientific data that we collect for your community to help model and predict for your community. So everybody on this call, you have a NOAA office in your area. If you don't know where yours is, look it up, and we have people available to help you with all of that information.
Thank you, Shally. Really appreciate that. So again, thinking about this response and resilience component, let's look at FEMA and Paul. We do think about FEMA as emergency response mechanism. I mean, it's in the name, right? So, but hazard mitigation is also a part of what you do and within your purview. And the more that we can invest in resilience, the more we can reduce disasters associated with extreme climate events and weather events. So can you talk a little bit more about FEMA's work across the spectrum in the context of extreme heat?
Absolutely, Kristen, and thank you so much, for bringing us together and for moderating this panel. One of the things that we need to acknowledge is that before disasters, FEMA works with and invests funds in communities to face the challenges brought by climate hazards of today and also climate hazards that we can anticipate for tomorrow. That's why that for us, simulating decision-making of climate scenarios is very important to prepare for and respond to extreme heat events, and also to test the effectiveness of heat emergency plans. And that is why through our National Exercise Program and also through our Emergency Management Performance Grant, we provide support to states, local, tribal, and territorial partners to assess and enhance response capacity, capabilities, and training. We all been talking recently, right? How impactful and how powerful information is in order to help us prepare, right, against extreme heat events. And to that end, FEMA published early this month the Extreme Heat Data Digest. And pretty much this resource, help bring emergency managers together to look into information about how prepare our communities when it comes to extreme heat events. And that information can be very useful on developing targeted messaging that can help encourage and help communities prepare for extreme heat. Also, it's not only the training piece and the response piece, as you well mentioned, Kristen, it's also the resilience aspect. In FEMA, we have a number of hazard mitigation assistance grant programs that can help mitigate and reduce risk resulting from extreme heat hazards. Pretty much our hazard mitigation assistance program, including FEMA BRIC, the flood mitigation assistance, the post-fire, can provide assistance to build infrastructure that is resilient against extreme heat. When we talk about like the possible ways that these programs can provide assistance to communities, we're talking about like 4 categories, if you will. One of them is hazard mitigation planning. It is very important that for the state and local, tribal, and territorial hazard mitigation plans to reflect, the hazards, and also to have a more in-depth analysis in how these hazards make the communities and the services that the government provide more vulnerable. Part of this planning exercise and planning assistance, can include mapping heat islands to support vulnerable communities and also help inform the vulnerability analysis of that plant. Also, when we're thinking about hazard mitigation projects, we look extreme heat as a way to provide multi-hazard risk reduction projects. Think about, for example, nature-based solutions. Nature-based solutions is not only a strategy, right, to reduce flood hazards, but also is a strategy that can provide shade, that can provide a space, right, for cool temperatures during extreme heat events. Another aspect and another way that we can provide extreme heat mitigation is through climate smart building materials. And that have to do with the manufacturing of materials and the uses of materials that use less energy. And with those materials, we can build and pretty much help reduce the pollution that causes global warming. And lastly, also we can provide assistance for resilient hubs. When you think about like critical infrastructure and critical facilities providing services to communities, it is very important that those infrastructure provide environments where people can be. And one of those environments, right, during an extreme heat event, could be like more of a cooling environment within those infrastructure. And that's pretty much like ways that, FEMA, we are working with communities and also with our state partners, territorials and tribal partners in order to build climate resilience, particularly for extreme heat.
Thank you, Paul. It's really interesting to hear you talk about resilience hubs, because I can see where they're so important. And we've seen them stood up in certain places around the country around extreme heat, but how they can also be helpful in terms of deploying resources into communities to build resilience and build on the ground preparation, but also as shelters during emergencies. And so I'm glad you brought that up. And if we have time, I might come back to that with some of the other people on the call. So I'm going to go back to Health and Human Services and to Dr. Balbus. So we're talking about climate resilience, and Health and Human Services has so many supporting programs in existence, like NIHHIS, which did get a shot in the arm from the bill investments. And I wonder if you would talk a little bit more about that and or anything else that you want to respond to that you might have heard.
Thanks, Kristen. So, I did make a reference to this pivot from assessments and resources and tools and data sets to actual actions. NIHHIS is one example of that. It received, millions of additional dollars. And over the last few years, the states have started to move more and more towards using the NIHHIS dollars, which have traditionally been used to supply heating assistance in the winter, to do cooling assistance in the summer. And I just want to say, the Assistant Secretary for Health will be speaking on day 3 of NIHHIS, and I don't want to steal any of her thunder, and she's going to be talking a little bit about these things. I'm really grateful for the opportunities to talk about these pivots. So she will provide a little bit of additional detail about that. But another realm in which HHS, our office is doing things, CDC is doing things, but all of HHS is starting to make this pivot towards action to the creation of resources. SAMHSA has provided a whole resource for addressing mental health needs associated with climate change and disasters. HRSA is taking its technical assistance for community health centers, and it has established criteria for the contracts for that for the technical assistance program to be supporting community health centers addressing the needs of patients with respect to climate change. And then CMS has been active as well. Most recently, this isn't specifically a heat thing, but a very important part of the action related to climate heat resilience of health systems was the provision of a permanent waiver from Medicare and Medicaid that will allow all health systems, with the exception of nursing homes, that's a technicality, to be able to use health system microgrids. So solar-powered microgrids, wind-powered microgrids with battery backups. Those had not been allowed previously. The requirement was for a diesel-powered backup or a different kind of power backup. Now there is this waiver based on, the most recent building regulations that allows this. This lowers a huge barrier for the decarbonization of the health sectors. And of course, the diesel generators in the setting of, let's say, a major heat event power failure or a hurricane power failure, the diesel generators pop on and they start pouring out diesel fumes into the surrounding neighborhoods. So it's also a community health issue. It's also, and the people who are living often at the walls of some of these major medical centers, at least, are often low-income communities, and so it's an environmental justice issue as well. So that's a big kind of leveraged change in what's going on, within HHS. I did want to just second on this idea of climate resilience hubs, and we're partnering closely with HUD and with other agencies, with FEMA, on the idea of, these are relying on braided funding already, braiding different funding from the different federal agencies, but we want to throw a thread into that braid that will be the healthcare services, and whether that's community health centers, essential hospital outreach, to bring the health services right into the brick and mortar of these resilience hubs in an integrated fashion, so that, again, it's providing that year-round, one-stop shop integration of health and human services, but then also we have the ability to provide continuity of care in the setting of a major disaster when other things are closed down.
Well, you couldn't have teed that up better when you say brick and mortar, because now we're going to turn to HUD. Thank you. Alexis, we heard a little bit about building materials from Paul and FEMA and opportunities there. We have OSHA's moving forward with regulations to protect outdoor workers. And then we have, of course, people in their homes who are at risk if they don't have access to cooling. So curious about what you see as HUD's role, and what are the opportunities as you see it to engage and to support some of the climate resilience planning that's happening?
Great. Thanks so much, Kristen. And I want to start by thanking NIHHIS for all the work that's been done to date, and for inviting HUD to participate in this event and in this panel. As you know, we're new to this group, but we're here today because we have a growing interest in the space. HUD, as folks know, is the federal agency dedicated to creating strong, sustainable, inclusive communities and quality, affordable homes. As it's been mentioned, we're on the front lines of the nation's efforts to tackle the climate crisis, to build resilient communities, and to address environmental injustice. And we understand the ongoing threat presented by climate change, because climate change is hurting the very people we serve. In terms of HUD's role, a few things come to mind in terms of the work we're already doing. The first is our disaster recovery work. As folks know, HUD plays a critical role in the federal government's efforts to help communities respond to, recover from, and build resilience to devastating natural disasters such as extreme heat and to long-term slowly unfolding climate impacts. Our programs are rooted in serving the people who need the assistance most, low and moderate income people. HUD also has a role in the community development space. Our community development programs, like our community development block grants or CDBGs, Section 108 loan funds, choice neighborhood grants, and other resources, give states and qualifying local governments and communities funding that can be used to help build climate resilience, including to extreme heat impacts. Ways HUD is doing this work is through efforts like we have the Climate Communities Initiative, which is a technical assistance effort to help educate and support grantees in using HUD funding for climate resilience. CCI, as we like to call it, includes toolkits, implementation guides, and other technical assistance. It includes specific information or implementation guides on creating the cooling and resiliency centers, like what John talked about, installing cool roofs, integrating nature-based solutions like trees to reduce the heat island effect. And so, HUD has been here in this space and is in the business of helping communities think about and address extreme heat impacts. That's just one side of our shop. So then on the other side, HUD does have over 4.5 million HUD-assisted properties. HUD received $1 billion under the Inflation Reduction Act for the Green and Resilient Retrofit Program, funding that will support long-lasting and equity-driven investments to reduce carbon emissions, develop climate resilience, and improve health and quality of life of residents in qualifying HUD-assisted multifamily properties. But beyond that, with all of the funding that has come down under the Inflation Reduction Act, the Bipartisan Infrastructure Law, and other laws, we are really looking at and thinking about how those funds can be used to help support HUD-assisted programs and properties, including affordable multifamily, to increase climate resiliency and support green retrofits that can make our homes healthier, more energy efficient, and more resilient, including resilience to extreme heat. As John talked about, the braiding and layering of these funds with HUD resources will be key. And one role that HUD has and that we're really focused on is helping HUD program participants understand how these funds can be used to increase resiliency, including how resiliency can help address heat. On the research side, we've been having conversations with John and other folks, engaging with our interagency partners to learn more about their work, research in the space, sharing knowledge and information, and discussing opportunities for projects that look more at the intersection of heat, health, and housing. That talks a little bit about what we're doing and what we're thinking about today as we come in, but the key and the big part of why we're here today is really to learn more about the opportunity, to listen and learn and to see where to engage and to support. I'm also very excited to say that I'm joined by a number of my colleagues at HUD who are participating in this, which I think is terrific. And I just want to, again, express my thanks for the invitation to participate. While we may be new to this group, we've been working in climate resiliency for decades, and we really look forward to leaning in more on this topic and working collaboratively with our interagency partners.
Thanks so much for that, Alexis. And I have to say, just welcome to the club, and it's the Cool Kids Club. So let's make sure that we bring all of our other agency partners along for the ride, because like you said, everybody has a role in climate resilience. Y'all have been doing this for decades, and we need to bring everybody in so that we can bring this together. I think such a huge opportunity, like you said, braiding and layering all the fun. So thank you so much. And so I'm so glad that you brought some other folks from HUD to help participate in all of this. This is great news. And so certainly, last but not least, Dr. Holofield, we heard about urban planning. We've heard what HUD's doing, and an important consideration there, of course, is urban tree canopy and greenscaping. So I wondered if you could talk a little bit about the recent announcement, the urban canopy program, and what you all are doing at USDA.
Okay, and thank you for the invitation to be here today. And on this esteemed panel, I feel honored to be here today. Normally, our AD Beatra Wilson would have been presenting, but we have been very busy over at the Urban and Community Forestry Program. So I do have a few slides I'd like to share with the audience if they're available. If not, we can just continue to talk. So basically, I just want to give you a really quick overview of our program. Urban and Community Forestry is a Justice 40 program, and it is designed, forgive me, my computer is not functioning right now, and it is designed to direct funding to communities experiencing low urban tree canopy, as you has suggested, dead and hazardous tree conditions, extreme heat and severe flooding, as well as limited awareness to access to green job workforce. So we want to help these communities, these disadvantaged communities that have been suffering for so long, to become more resilient to climate change, to benefit from the cooling effect of increased urban tree canopy, UTC, to experience improved health conditions and safer access to tree benefits where people live, work, and play. Over 84% of our population reside in urban areas, and also to attain a broad exposure and access to environmental career pathways. So next slide, please. So a little bit about the Urban and Community Forestry Inflation Reduction Act public notice of funding, which was announced on April 12th. Up to $1 billion in funding will be distributed through the UCF program in the form of competitive grants, cooperative agreements, and technical assistance. The funding opportunity is open to proposals spanning a broad range of costs from eligible entities working at a community, regional, and national scale. The minimum for any of these projects is $100,000. The maximum will be $50 million, and all funding agreements will be for a period of 5 years. So you have 5 years to extend the funds. All federal grant funds are to be matched at least equally, dollar for dollar, with a non-federal match. However, match waivers are available for proposals that deliver 100% of the funding program benefits to disadvantaged communities. And we like to emphasize that we like to use the CGES tool to define those disadvantaged communities to get that 100% match waiver. So next slide. So what we have here is that Urban and Community Forestry Program has been on the front lines, literally on the front lines of climate change. So we've had several funded projects that have focused on expanding our iTree program, a suite of tools to include a temperature module to address health and environmental justice issues related to extreme heat. And some of the findings that we have discovered through our data and research is that heat-related disasters kill more Americans than all other natural disasters combined. Now, that is a staggering thought to comprehend. When we talk about heat-related mortality, we're looking at almost 1,300 to 12,000 deaths annually. 700 deaths alone in Chicago occurred during a heat wave in July of 1995. So as the temperatures begin to change, projected increases in heat-related deaths nationwide compared to last decade is expected anywhere between 36,000 to maybe 100,000 people to die within a given year. And in particular, a Baltimore, Maryland case study showed the impacts of increasing the area of the current tree cover by at least 10% of each census block group. We could reduce annual mortality by at least 250 deaths. And also by increasing our tree canopy, the economic value of these avoided deaths can range anywhere from $690 million to $1 billion. So those are some staggering facts. So we also look at in our states, Virginia, Los Angeles, California, Arizona, they all have robust programs where they're looking at tree canopy to mitigate extreme climate, to mitigate the heat islands in those areas. So like I said, we have been on the front line for a very long time. So hopefully these RA funds will allow the Urban and Community Forest Program to assist these communities with mapping of their urban heat islands and creating and implementing plans using heat mitigation infrastructure and greening solutions on a short-term and long-term basis. And for those of you who are looking for more information, I will drop the links to our program as well as a link to our public notice of funding in the chat box. And please visit us, and we welcome all questions and inquiries that will help communities get to where they need to be in the future. So thank you for the opportunity in presenting. I appreciate it.
Thank you, Dr. Holifield. I really like that because I think that your example gives us a flavor of a very specific project and deployment of those resources, what we're doing to actually get them in the community, how it touches on those equity issues, and about the value of the cost share and, of course, the CGES tool. So thank you so much, because we've heard from the programmatic level and now we're hearing a lot more detail. So thank you. I think we've covered a lot here. So In the remaining minutes, I'm going to go through each of you. We're going to do a speed round and ask you in 5 words, what did we not cover today that you think we should collectively be doing to build our resilience to extreme heat? And I'm going to start with you, Dr. Holofield. Let's go reverse order-ish.
Oh, Jesus. Okay. I'm on the hot seat once again. Well, building resilient communities right now. That's what we need to do. And I think that was in 5 words or less.
Nice work. All right, let's go next. Alexis.
Great. Just building on my earlier remarks, increase collaboration across our agencies. I think it's so important because it ensures we're good stewards of our taxpayer dollars. And we could always be doing more for our communities when we leverage our knowledge, data, and information.
All right, Dr. Balbus.
For something we didn't cover today, mental health and tribal communities.
Duly noted. All right, Paul.
Yes, I'll say definitely, we should be talking also about quantifying infrastructure impacts resulting from extreme heat events.
Okay, Dr. Malaysi.
I would just reiterate what I'd said, hazard timescales in the continuum. So it's not just what we're doing in response, but it's sort of the long term as well.
And back to the beginning, Dr. Osborne.
Man, great ideas. Ways to accelerate the work that surpasses the rate of climate change.
I think that was more than 5, but I'll let you pass. So
I was hoping you'd let me go on it.
No, truly, I cannot thank you enough. And I think all the things you just articulated in that last couple minutes, I think you got an agenda for NIHHIS National meeting number 3 in a year from now. And we're really looking forward to these discussions. But I think that also sets the stage for discussions that the folks who I see on the screen right now, what we need to be doing collectively moving forward, and who are the other people that we need to bring into this umbrella. And I have to say, I just love hearing everything that you're doing. And it's such a pleasure to be able to elevate all of your work, and particularly the collaborations and what you all are doing together to achieve what you wouldn't be able to do alone. And I look forward to supporting everything that you're doing. And so please, I might regret this, but please let us know what you're doing in this space and how we can help promote it. So that way we can make sure that we're deploying things into our community to protect our populations and our natural resources from extreme heat. And with that, I'll turn it back over to Julie. Thank you.
That is an amazingly hard act to follow. Kristen, thank you for leading such an amazing panel. You all did such a spectacular job. I love doing this job. I feel like I am so fortunate to come to work every day and have to help the people of the United States protect themselves from heat. But this panel was actually amazing, and I am honored to be a part of it. Really, thank you for leading it. Thank you to every single one of you for being there. You're going to hear, those of you who are listening in are going to hear from this panel, parts of the agencies, EPA and NIHHIS, other parts that you've heard about today. You'll hear it a little bit more depth throughout the rest of the meeting tomorrow and the next day. But I just want to say thank you so much to the panelists now, the disproportionately affected, the 2 panels that went before, our leaders, the Dr. Spinrad and Dr. Walensky, who opened the day. We heard from OSHA as well. We've had a very amazing amount of federal leadership engaged in this. And that is partly how we've been able to kind of raise the awareness and elevate the importance of managing heat risk on timescales in the federal government. So part of this was for us to be able to talk with you about what we're doing, but we also want to hear from you and engage with the rest of you on the call and the rest of the meeting. It's a little bit more interactive. We have a networking session in just a few minutes, so we're going to make sure that you don't miss that. But I just wanted to take a minute to say thank you all to everybody who's gone for this day and into the rest of the week. Really, what a great setup. And I want to also thank you to my co-chairs, and one more thank you, which I think Paul is going to say, but I suspect that if you've registered for this meeting, gotten emails from anybody, you've probably seen Morgan Zabow's name on something, right? So Morgan works for NIHHIS in NOAA. She's in our team in the Climate Program Office. And I don't know if Morgan is able to, without her, this would not have happened. And without the CDC Zoom team, that was on the call earlier, it would not have happened. So I just want to call out, yes, thank you very much to Morgan, and then and to the CDC team. You know, she's managed everything. She's put it all together. So Morgan, thank you very much. Very great job. And then Paul, why don't you wrap it up? And then Morgan, I think you're going to tell us how to get onto the Zoom networking session. So if you're interested, you have questions you couldn't ask before, we really have a very packed agenda. We're trying to be respectful of people's eyes and Zoom time, but we also wanted to be engaging. So we've got one networking session today, and I'll turn it over to Paul to wrap it up, and then Morgan to tell us how to find our way to the Zoom meeting.
Yes, thanks, Julie. And of course, I'll echo that huge thanks for Morgan, but also for all of our presenters, moderators, as well as agency leadership for participating today and for really bringing your expertise to this topic. So this is only the first half day of the second annual national meeting. We have 2 more action-packed days. I wanted to give a really quick preview of tomorrow's session, which hopefully you'll be able to attend. So the focus tomorrow is on highlighting science, innovation, and research. So we'll have some really great different sessions, including on innovations in communication around heat, new emerging research on heat and health, some discussion on indices that we set for heat and health, and then also more presentations and discussions on urban heat islands. So hopefully you'll come back for that for the second day. We hope to see you all there tomorrow. And I'll turn it over to Morgan for information on our networking session.
Thanks so much, Paul. So as you can see on the left-hand side, we do have a heat and health networking session that's going to be starting at 4:15 Eastern time today. So giving everyone a 15-minute break, go get some snacks, get some water again or coffee, and join us. Again, we are going to be transitioning to a different Zoom platform. It's going to be a meeting platform, and the Zoom link is in the chat, and you can also register on heat.gov as a way to get the official calendar invite as well. But in this meeting platform, we'll be able to have some different breakout rooms that will have some different themes, and those themes will be about communicating heat risk, research opportunities, urban heat islands, heat governance, social and community vulnerabilities, cooling strategies, environmental justice, resource and tools, and state, local, territorial, and tribal stakeholders. So if any of that sounds of interest to you, please come and join us. It'll just be for 45 minutes and a great way to network and meet some new people and maybe make some new relationships and collaborations. So hope you can join us. And again, that link is in the chat. And with that, I will turn it back over to you, Paul.
Yeah, thanks, Morgan. Hope to see you all in the networking event. And if not, then we hope to see you all tomorrow for the second half day session. Huge thanks again, everyone.
Tomorrow's on the innovation, science, research, communications. So they got a lot packed into tomorrow. So please join us. And then Thursday is on the state, local, tribal, territorial stuff. So if you're not already planning, clear out your calendar and join us. All right, see you in a few minutes over the networking.